My name is EmpressParis, and this is a segment of Conversations with Empress. Tonight's topic will be women and STDs. All right. I will bring up items dealing with STDs when it comes to oral, when it comes to sexual, and I will take comments and questions from the audience. All right, so without further ado, let's go ahead and start the show. Okay. All right, again, EmpressParis, women on STDs. So there are quite a few commonly known STDs, and we'll focus on those. And please, let me be clear, I am not a physician. By any means am I posing to offer you any medical help. I will not be examining you. I will not be diagnosing you. I'm just here to basically pull up facts in regards to the most common STDs, all right, known to women. And we will talk about these common known types, starting from human papillomavirus, genital herpes, Chlamydia, Gonorrhea, HIV, AIDS, and Syphilis, and maybe one or two in addition to. Again, I will not be offering you any health diagnoses. Again, I'm not posing to be your physician or any healthcare provider. I'm basically just having a conversation. Again, this is Conversations with Empress. And again, tonight's topic is women and STDs. All right, so let's get into it. Basically, not even on this application, but just in life in general, there are women that mate. They mate and they date. And whether their preference is to date and mate with men or women, there are some warnings or some precautions that need to be taken when being sexually involved. There's a lot of people when they meet individuals, they choose not to say, hey, I like you, you like me. Before we have sex, maybe in the future we may decide to have it unprotected. Let's go together and get tested for a couple of STDs. I think that would be a beautiful conversation starter when you're dating someone, because for me, it makes me feel as though there can be some trust, in this relationship, and also there will be some awareness in this relationship. Who wouldn't want to know whether or not the person that they are dating or about to be committed to is healthy or unhealthy? Okay, or maybe they have a sexually transmitted disease that can't be treated, or maybe they have a sexually transmitted disease that can be treated. So I think, being aware, made aware, being in the know, also giving an option on whether or not you want to go forward with a relationship, as opposed to not having an option and not being aware and you're going forward with a relationship. So I think, being able to at least know somebody's health status is important. Okay, so hello. All right, so let's talk about the first most common type of STD. And if I want to make you aware of the STD and basically what they classified as from WebTD, thank you, Danny from the D. What they classify an STD from WebTV is an infection transmitted through sexual contact caused by bacteria, virus, or parasites. Okay, so that's what we're classifying STD as today. All right, and I'll repeat that: an infection transmitted through sexual contact caused by bacteria, viruses, or parasites. All right, so let's keep it moving. So the first one that we will discuss is the human papillomavirus infection. All right, now, does anyone have any idea what the human papillomavirus is? Also, it's known as HPV. Is anyone familiar with this infection at all? Oh, okay, so was brought to me to a company by the name of Planned Parenthood. And HPV was, you've heard of it? Perfect. I'm proud of this. That I learned about HPV is, of course, you get it through sexual contact. Hello, Miss Wedding Thick. You get this through sexual contact, and also if you get the Gardasil vaccination prior to having sex, the Gardasil vaccination was to basically protect you from getting the HPV virus. But this Gardasil vaccination was to be given to a young female between a certain age. It could have been 13 to 18, or prior to them having sex. Okay, it was also noted that once a female has started having sex, the Gardasil vaccination probably wouldn't be so preventable when it comes to getting the HPV virus. Now, this HPV virus will cause internal infection and can morph into cancer in your womb and your uterus. All right. So treatment for HPV wasn't known. There was always medication that you can take to treat HPV, but we were clear that if you gave your daughter the Gardasil vaccination, it would prevent them from getting it. Also, there were certain studies known that when men contracted a young lady that had HPV, he would get the virus with no symptoms at all. No symptoms, no ailments, nothing. And he could pass that virus on from one young lady to the next, even by kissing. Deep, 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 deep kissing. He would have no type of hint that he even had the disease. And he could pass it along, meaning if this one young lady had HPV and he put his mouth in an area where he could contract it orally, he would carry that infection in his esophagus. And he's now able to pass it along to another young lady. Okay, so HPV can cause what we know today as cancer, again, in your uterus and in your womb area. And we all know once you have uterine cancer or cancer in your fallopian tubes or anything in that area, that's a very sensitive area. And if they're able to remove those parts, by the time it's stage 1, then that's a home run, that's a win. But if they're not able to move your parts and you're at stage 3 or 4, that could really be detrimental to your health, your well-being, and your livelihood. So that's human papillomavirus. If you want to know any more about the HPV virus, you can basically go look it up. Just go Google on WebMD and get some more information on the human papillomavirus. Okay? Also known as HPV. All right, so now let's talk about genital herpes. Let me get a link. She didn't give me a link. Genital herpes. All right, so genital herpes is a very interesting, very, very interesting little buggers. Okay, they look interesting when you see them. They feel interesting, and some women actually have to find comfort doing different things when they have a flare up. So let's talk about genital herpes or genital warts. All right, so now common are caused by certain types of HPV. So believe it or not, certain types of HPV. So HPV doesn't even come in one form. And we just spoke about the human papillomavirus. According to MD, HPV comes in different types of forms, and it can cause genital warts. Okay. And this can be very annoying. These genital warts can be very annoying, but they're treatable and aren't dangerous. These are genital warts, okay? They're treatable and not dangerous. Now, I see that they say treatable, but I don't see anything that says they're curable, all right? So some symptoms, okay, some symptoms that you might see if someone had genital warts or genital herpes, all right? Genital warts are skin-colored or whitish bumps that appear on your genitals or your anus, okay? You can also have the virus that causes genital warts but not have any symptoms. So there are people that can walk around with genital warts and don't have any symptoms, meaning you don't see any whitish, brownish bumps in your areas, and you're just walking around freely. And you may be able to even pass them on to other individuals without knowing that you are infected and you're infecting someone else. All right, so let's continue to talk about genital warts. All right, symptoms. Again, it looks like skin-colored or whitish bumps that show up on your vulva, vagina, cervix, penis, scrotum, or anus. All right, so this is in men and women. All right, not only that, they kind of look like pieces of cauliflower. So I'm assuming that's when you have a breakout. These little whitish skin-colored bumps that show up on all your private areas, they look like whitish pieces of cauliflower. You can have just one wart or a bunch of them. So some people may have one wart, or you can have a bunch. All right, and they can be in a big area or a small area. They might be itchy, but most of the time they don't even hurt. Okay, so I do know there are people that find comfort when they do have breakouts. Okay, and when I say breakout, I mean when these little skin-colored whitish bumps show up on your genital areas. The breakouts could be itchy and uncomfortable, and some people find soothing them could be sitting in a bathtub or using a blow dryer to cool them off, or basically lying down, probably having their legs open and having a fan blow to just cool off that itchiness. Because from what I understand, scratching will really, really irritate those genital warts. Okay. Now, don't get confused. Not all bumps that you have in your genital area are genital warts. Okay, so let's not get that confused. There are other infections and normal skin conditions that might look like warts, but can definitely be something else. All right. Now, when do these genital warts develop is a good question here. It may take several weeks upon contact. So you can probably have sexual contact with someone that has genital warts, but it may take you several weeks to even say, oh my God, something is wrong here. Meaning, what if you had 2 or 3 sexual partners? You can have sex with someone 3 weeks ago on Monday, then have sex with another person in 2.5 weeks, and you may think that individual is the one that gave you these itchy little bumps. But it could actually, in actuality, it could be the individual that you had sex with 3 weeks ago. All right, so that's a fun fact to know. It can take several weeks or even months or even years after you have sexual contact with someone with genital warts. All right, so this is why it's so hard to know when you got the HPV infection that causes it, who passes it on to you. All right, so just take that in heed. All right, take that in heed. All right, now, so if you have the HPV type that causes warts, I'm assuming that says herpes, not HPV. That'll be herpes. If you have the herpes that causes warts, let's talk about one more form of herpes. There's another herpes that we call herpes simplex 1, I'm assuming, and this is known as fever blisters on the mouth. So there are some young ladies and men that actually have fever blisters. That's actually in the herpes family. We do know that that is treatable, and we also know that fever blisters or cold sores are preventable if you keep everything moisturized and clean. But yes, those genital warts that you get there, those cold sores or whatever, that's a cousin. That's in the herpes family, and it's a herpes simplex. All right, so keep that in mind. It's totally different from the genital herpes, but they're in the same family. Okay, they're in the same family. Now, if anyone have a question, you can come right on up and ask me a question about these diseases, or if you want to bring some insight, or maybe you know someone that have had or any insight, please be you're more than welcome to hit the join button, and we can have a discussion in regards to STDs, okay, sexually transmitted diseases. Other than that, we're going to keep it moving. All right. All right. So it's very, very important to always to talk and communicate with your sexual partner as well as with your healthcare provider. All right. So talking to your partner and your healthcare provider always help if there's any complications involved, or if you're unsure on who and when you contracted herpes or genital warts. All right. Communication is key, guys. All right. Communication is key. Now, what if you did contract genital warts and you feel as though I didn't do anything? I didn't do anything. It must be my partner. My partner is cheating on me. I don't have genital warts. All right. What if that happened? This is not necessarily true. Again, it can sometimes take a really long time for warts to show up. So it's possible that you or your partner may have gotten them long ago. 3 weeks, a year, a long time ago. And these genital warts are just sitting inside of you, resonating. They're sitting inside of you, just waiting to have an outbreak or outburst. So if you had a flare up today, it's not necessarily who you're dating presently that gave you genital warts or herpes. It could be someone you dated again a year ago, all right, 6 months ago, all right. So it's always good just to be educated and just be in the know, all right. Now, in regards to the breakouts, all right, in regards to the breakouts, all right, you can get the virus and you never can actually get warts. So you can actually get the virus and have no symptoms at all. All right. So you could be infected and not have any symptoms, of course. And some people only get warts once. There's some people that only have a genital breakout once and never again. And then some people have warts that develop more than one occurrence. So there's people that have outbreaks after outbreaks. And outbreaks are what? The outbreaks are those little whitish and brownish bumps that show up in your vulva, vagina area, cervix, penis, scrotum, or your anus. All right. Some people never get them. Some people may get them once. Some people get them on a recurrence basis. And they find different ways to comfort themselves. In regards to treatment for herpes or genital warts, again, make sure you just contact your healthcare provider, contact the clinic, any type of healthcare provider, so that they may test you, see exactly what form of herpes you have, so that they can treat you properly. Again, I am not your healthcare provider, and I will not be recommending any type of medication or treatment for any of these sexually transmitted diseases that we talk about today. But you can contact your local primary care provider or gynecologist or a nurse practitioner in order for you to go in and get tested, so that they can actually administer some type of treatment, form of oral or some type of injection for you. Okay. All right. So let's get into it. Next disease. Remember, we're going to talk about several of them, right? What's on our lineup? We've already spoke about human papillomavirus, right? Human papillomavirus, and we learned that if you take the Gardasil shot when you're a younger person, it can prevent you from getting the HPV, all right? And if you don't, it's possible that you can have that HPV virus, don't know you have it, and it can turn to cancer. Not only that, young men can actually contract the virus, have no symptoms, and they can actually pass it from one young lady to the next. Okay, so that was the HPV. Now we also we covered genital herpes. All right, so we didn't inform you that it's a sexually transmitted infection marked by genital pain or sores. They can be brownish or white. They can look like cauliflower. They can cover your area, your front genitals, vulva, vagina, penis, scrotum, or your anus. You may get a breakout once. You may never get a breakout, or you can get a breakout over multiple times. Also, just because you have a breakout doesn't necessarily mean it's the person that you're dating now. It can actually be someone you dated a year ago. All right. And this herpes has just been sitting around, just marinating, waiting for an outbreak. Also, you got a cold sore here. You get a cold sore or a blister, that's a form of a herpes simplex. All right. Okay. So also, it's always good to communicate with your partners. Also, communicates with your doctors or your nurse practitioners so that you can go out, get tested, and get the proper treatment needed to treat your infection or cure it if it's a cure. All right. So those are the two we've covered so far. So let's move along. Let's talk about chlamydia. Chlamydia. All right. Anybody in the comments ever heard of chlamydia? Anyone? Anyone ever heard of chlamydia? Anyone have any questions? All right. Lana says yes. Lana says yes. So let's talk about chlamydia. Bam Bam says yes. Perfect. All right. So now we're moving on to infection number 3, which is chlamydia. All right. So what is chlamydia? Let's talk about it. All right. So what is chlamydia? What is the symptoms? Is there diagnosis? And is there treatment? Thank you, Bella. All right. So chlamydia is caused by bacteria called Chlamydia trachomatis. All right. It can be transmitted through oral, anal, vaginal sex, as well as skin to skin contact. All right. So let me repeat that. Chlamydia can be transmitted through oral, that's mouth, anal, that's man or woman in the back, vaginal sex, female vaginal sex, as well as skin to skin contact. She's in Target. All right, so and that's according to the Centers for Disease Control and Prevention. That's the CDC. All right. So again, we're talking about STDs, but chlamydia is also known as a STI. You got a sexually transmitted diseases, and then you have sexually transmitted infection. All right, and chlamydia can be both. All right, so let's talk about chlamydia in the throat. Ooh. Chlamydia is sometimes referred to as the silent infection, okay, as it often doesn't bring about symptoms. This can cause a false sense of security and can lead to some complications if the infection is undetected, okay? So basically, if you have chlamydia and it's giving you no detection, that means you can go on infected with this disease and not get any treatment, and it can cause complications in your uteral area in the future. All right. So what are the first signs of chlamydia? Chlamydia symptoms in women. Are we ready? It's a couple of them. You ready? Painful urination. It could be a sign. It can also be a urinary tract infection as well. But that's one of the symptoms. Okay. Painful urination. Cloudy urine. Is your urine cloudy? When you urinate, is it gold because you didn't drink any water? Is it clear because you're drinking water? Or does it have a cloudy, faddish look? Okay, look at your urine, ladies, when you use the restroom again. All right, not saying that you got chlamydia, but that's one of the signs. Okay, what about abnormal vaginal discharge? We all know as ladies, we should be able to put on our underwear and walk around with nothing coming out. If there's something coming out of you abnormally that smells weird, it could be brown or yellow or different colors, something isn't right. Even if it's not chlamydia, it could be something, ladies. Remember, you have to consult your physician or your nurse practitioner. If something is coming out of you and it's not just your normal, like, oh, urine is in my underwear, but it's something, a weird discoloration, leaving a stain and an odor, go get that checked so that it doesn't cause any further complications for you in the future. Okay? Because when bacteria surfaces and it's just sitting there resonating, it can do other things. It don't have to stay chlamydia forever. It don't have to stay gonorrhea forever. It can morph into something like cancer, and we don't want that. Okay? So if it's discolor or if it smells weird, consult your physician or nurse practitioner. All right. Another symptom of chlamydia, genital itching. Are you itchy down there? Okay. Thank you, Goddess Pineapple. Are you itchy? And the reason why you might be itchy is because you may have a discharge that's coming out, and that discharge is drying in your vulval area, it's drying in your vaginal area, and it's making you itchy. And it smells a little bit. So if you have a little stinky, itchy, consult your physician or nurse practitioner. It could be something abnormal going on and you want it to be treated. All right. Also, abnormal vaginal bleeding with intercourse or between periods. All right. Abnormal vaginal bleeding between intercourse or between periods. So if you're just having casual sex and you're bleeding and it's not your menstrual, that could be a symptom of chlamydia. All right. Or if you're having just little spots of blood between your menstrual, that also could be chlamydia. And what are we going to do? Who are we going to consult? Comments. If we see something abnormal or smell something abnormal, who are we contacting? Comments. Who should we be contacting? Not Empress, not me. Who should you contact when something's abnormal coming out of that private area? Because that area is like a secret garden. It should always, thank you, Queen Gwen, your gynecologist, your nurse practitioner. Come on, Freak Nasty. Exactly. So thank you, ladies. Exactly right. Your physician, a doctor. Come on, sis. That's right. You have to contact someone because that thing should smell sweet and nice. Okay. It's a sweet garden. So let's keep it smelling sweet and nice by making sure that you treat it if it smells abnormal. Don't be embarrassed. Go get that taken care of. I'd rather you take care of an itch and a little discharge before it turns into something that we can't cure. All right. Dr. Miami, I'm just playing. Get out of here, Dior. How about irregular menstrual bleeding? What about fever and general tiredness? Now, that's one that's shocking. Fevers and general tiredness. So you're catching a fever and saying, damn, I'm tired and I'm kind of warm. That's something abnormal. We should not be catching fevers out of nowhere. Okay. And if you got a good night's rest and you're just generally tired for no reason, consult your physician, your nurse practitioner, consult your doctor. Okay. Next, this is another sign of chlamydia: swollen and painful glands at the opening of the vagina. These are your Böcklin glands. So at the opening of your vagina, it can be some swollen or pain there, some tenderness right at the opening. If you look inside, if you're down there poking around, as you should, women, you should have a mirror sitting in front of you and you should be pushing and touching and looking. You always should be looking and touching and poking in that area. Why? It's your area. That is your sacred place, and you want it to look healthy, you want it to feel healthy, and you want it to smell healthy. So in order for you to identify some things, sometimes you have to just go and be that private eye and just take a closer look, okay? Also in conjunction with contacting your physician and your nurse practitioner, okay? So if you are in that opening area and when you push it, it's swollen, and if you push it, it's kind of tender and painful, contact your physician. It's one of the signs for chlamydia, okay? What about pain during sex? Some of us are having pain during sex, all right? Sex should be beautiful. It should not hurt. Unless you got inches on inches, sex should be something normal and natural. It should go in, you should get wet, and it should be pleasurable. If he's inside and you feel pain, that's abnormal. That's not pleasurable. You need to consult your physician and ask them, why am I having pain during sex? All right, that's a good question to ask. And last but not least, anal discharge. If you're having a bowel movement, you're using the restroom and you're just having a normal bowel movement, that's not anal discharge. But if you're just walking around with underwear, endometriosis can cause pain too. Another subject though. Right. Well, yeah, another subject, but thank you so much. Now, if you're walking and you have on your underwear and you look down and there's stains in the back of your underwear, that's anal discharge. Anal discharge, okay? And that might be a sign of having chlamydia. And we all know if we have any signs, we're contacting doctor, primary care. You can go to the emergency room or your nurse practitioners, okay? Or any local clinic. Don't be embarrassed. Let's prevent this stuff. Let's treat it, Almond Joy, before it turns to something that can't be cured. It's very important, okay? Very important. All right, so far we've covered what? HPV, human papillomavirus, right, which can turn into cancer. Men can carry it in their throat. They can kiss one girl and give it to the next. It can go undetected, but you got to get it treated. We also talked about genital herpes, genital warts. We just covered chlamydia. Now let's see what's next on our list. What's next on our STD list? The next sexually transmitted disease or infection transmitted through sexual contact caused by bacteria, viruses, or parasites is gonorrhea. Okay, gonorrhea. All right, a sexually transmitted bacteria infection that, if untreated, may cause infertility. Meaning, if you have the STD known as gonorrhea and you don't get gonorrhea treated, it can cause you not to be able to bear children. All right, so let's get into it. Let's talk about gonorrhea. All right, let's get into it. Okay. Any questions from anyone in the comments? Anyone wants to come up and say anything? This is an open panel. Okay. Anybody? No? No. Dior says no. 2P? You want to come up and just use the restroom? Freak Nasty wants to come up and pee? Is that what we're doing? All right. If not, we're going to get right into gonorrhea. So let's go. All right. So we have a caller, Marcus Marshall. Marcus Marshall, we're going to assume that you have a question in regards to the topic this evening. Hello, Mr. Marshall. Mr. Marshall. Hi. How may we help you? Okay. My name is EmpressParis, Marcus Marshall. Thank you very much, Mr. Marshall. Okay. All right. So that was Mr. Marshall. He is watching and supporting, and we appreciate Mr. Marshall. Anyone else have a question or anything in regards to the topic tonight? Go, Mr. Marshall. All right. If not, let's get right into gonorrhea. All right. So let's do it. All right. So gonorrhea. All right, so search for gonorrhea. I'm searching for treatments, recognizing gonorrhea. That's a good place to start. And treatments for gonorrhea. Right. Thank you, boss. All right, so let's get into it. All right, so early signs and symptoms and warning signs for gonorrhea. All right. They're coming up, you guys. Give me 1 second, please. Again, anyone have any questions? please come up and feel free to come up. And this is an open discussion. This is for us ladies to protect ourselves and just bring awareness. Remember, I am not your primary care physician or primary care nurse practitioner. That's not what I'm posing as. I'm just here as a vocal component or liaison just for awareness. All right, just something for us to talk about, some topics that are not really covered on the platform. I'm just here to bring awareness, just bring a reminder and awareness, because we all don't know everything. Okay, we all don't know everything. All right. All right, so I'm just going to read these little facts because they're not giving us a lot on gonorrhea for some reason. All right, so gonorrhea is an infection caused by sexually transmitted bacteria. It affects both male and female. Thank you, sis. Gonorrhea most often affects the urethra, rectum, or throat. Your urethra, your rectum, or your throat. Oof, okay. In females, gonorrhea can also infect the cervix. All right, ladies, so we got to protect our womb. We got to protect this area where we want to produce life. So gonorrhea is one of these diseases that will cause infertility. It will cause you not to be able to bear children. So if you can catch it, detect it, and treat it and get rid of it in time, you know, you can probably save yourself and be able to bear children. Okay? All right. All right, so gonorrhea is most commonly spread during vaginal, oral, or anal sex. So you can get it vaginal, orally, or anal sex, okay? But babies of infected mothers can be infected during childbirth. And babies, gonorrhea most commonly affects the eyes. So if you're a woman that's pregnant and you have gonorrhea and you've allowed this disease to spread and you have not treated it, you can cause your baby to become blind. Okay? So get it treated, all right? Abstaining from sex using a condom. So they're telling us what we need to do now. So let's just talk about gonorrhea. We already know that you can get it through sex, all right? Now, gonorrhea is one of those sexually transmitted diseases where you will have discharge that smell, okay? Yes, just like chlamydia, okay? So I'm looking for the symptoms to be more detailed. So let's try this one. Okay, so this looks good. All right, so symptoms of gonorrhea. Most people with vaginas who get gonorrhea don't even have symptoms. If they do, gonorrhea symptoms show up within about a week of being infected. All right, so this is a good one. If you have sex with John on Monday, more than likely, women, you will see the effects on the next Monday. This is not like herpes, where herpes can sit inside of you for a year or 6 months or 5 or 6 weeks. Based on what WebMD and the website called Planned Parenthood, gonorrhea will show up within a week if you get any symptoms. All right, some of the symptoms are pain or burning feeling when you pee. So if you pee or urinate and there's a stingy, hot, sting, hot, that is a symptom of gonorrhea. It could be that you probably had a yeast infection and you were scratching and you probably scratched yourself. Yep. But if you have pain or burning feeling when you pee, it also can possibly be gonorrhea. What about abnormal discharge from the vagina that may be yellowish or bloody? Abnormal discharge from the vagina that may be yellowish or bloody. That's a symptom of gonorrhea. All right. So we all know that any discharge that comes out of that vagina is a no-no. You should go get that checked. I don't care what it is. It can be Christmas colored with green and red and pretty with sparkles and glitter. If it's coming out of your vagina, go and get that checked. All right. Bleeding between periods. Now that's a symptom that's similar to chlamydia. All right. Now, people with penises are more likely to have symptoms if they get gonorrhea. The symptoms usually begin within a week after they get the infection. These are the people with penises. There are people with penises out here. All right. Yellow, white, or green discharge from the penis. Pain or burning feeling when you pee. Mr. Penis. Pain or swelling in your testicles. Ooh. So those things are painful or swelling. You'd be trying to say the blue balls, but it's a possibility that you have gonorrhea, my sir, my God. Go get yourself checked. There's a lot of men that don't like to go to the doctor. They're afraid of the doctors. But my dear, you can save your child's life. You can save the woman that you're dating life. Just go get yourself checked. Don't be afraid to go to your doctor. Now, gonorrhea can also affect your anus, all right? If you have anal sex, you may spread that infection to your anus from another part of your body, like wiping after you go to the bathroom. Anal gonorrhea doesn't have any symptoms, but signs of gonorrhea in your anus can include itching in or around your anus. So if you guys or girls are itching in or around it, you in there scratching and itching, go get that checked. That's abnormal. The anus shouldn't just itch like that. All right. Discharge from your anus. If you're walking around and there's discharge back there, that's not a normal anus. Okay, something may be wrong with it. Go and get it checked. Pain when you poop. No, it shouldn't be. No, there should be no pain when you poop. All right. Again, contact your primary care physician, your gynecologist, your local clinic, your nurse practitioner. Okay. All right. Now, gonorrhea infections in the throat also rarely cause symptoms. If symptoms do show up, it usually is just a sore throat. Thank you, Gate. So if you have gonorrhea in your throat, you don't really get a lot of symptoms, but it will cause a sore throat. So that means that if you got gonorrhea in your throat, how did you get that? That means you put your mouth on somebody's area that has gonorrhea. And it could have been an anus, it could have been a penis, or it could have been a vagina. Yes, they get it because they're putting their mouth on somebody that's infected. Remember Michael Douglas had that throat infection, that throat cancer, and they had put out that he had been putting his mouth on something that was infected, and his wife was Catherine. What was his wife? That beautiful lady? Yeah, if you got cancer and stuff, throat infection can cause cancer. If you put your mouth on an infected anus or an infected penis or an infected vagina and you just let it sore throat and you don't get it treated, that can cause throat cancer. Okay? So guys and girls, be careful where you're putting your mouth. Make sure you and your sexual partner, it's okay for you guys to go and get STD tests together. Go together as a partner. And if you know a young lady, and whether she's on Beagle or not, that just have countless sexual partners, and she prefers to have sex unprotected, sir, my guy, please go with your partner to your nearest clinic, primary care gynecologist, or nurse practitioner. And the same as women. If you have a gentleman that you're dating and you know he prefers to have sex with numerous partners and he prefers to do it unprotected, yeah, Michael Douglas. He has throat cancer. Exactly, TT. Michael Douglas. He had it. I remember some years ago he contracted. Please go with your partner, ladies, and get that checked. Okay, it's just a simple test. All right, don't be embarrassed. All right, so far we've covered HPV. We've also covered herpes, chlamydia, go together, bam, bam. And we've also covered gonorrhea. All right, so let's get into something that we all should be aware of. At least we should have awareness on this topic here. And I think the next one should be HIV. Okay, let's search it. All right, what is HIV? Okay, can someone get it by receiving an infected mouth? If you don't have mouth contact on other person, okay, can someone get it by receiving with infected mouth if you don't have mouth contact? Ask that question. Wait, Michael Dunn had throat cancer. Yeah, he got it some years ago. Yeah, he had throat cancer, and everyone was saying, like, where did he get it? How did he have throat cancer? He's married to Catherine Zeta-Jones. It was a big deal. He got it years ago. Google it. Cigarettes, yeah, but cigarettes also causes lung disease. Because you don't really swallow smoke, right? Smoke is right, and then it goes to nostrils, and then it goes through the lungs, right? How you get throat cancer? Well, I remember, but he was a smoker. Okay, so we can leave it as him being a smoker. That's fine. But say for instance, Nick or Diamond, someone takes their mouth and put it on somebody's infected area. Killer kills. What if somebody take their mouth and put it on somebody that has gonorrhea? What if you take your mouth and put it on somebody's anus that has gonorrhea in it? What if you take somebody's penis that has gonorrhea on it or chlamydia, and you just do whatever you do with your mouth on that penis and that vagina, and then you're done. Thank you. And we're still friends, right? And you're with this person for a long time, or you may have another sexual partner and you don't know, but those sexual transmitted diseases are resonating all up in there. It's the same with your vagina, with your penis or your anus. If you don't get this area treated, it can turn into cancer. If you're sitting around with STD stuff, I don't want to say STD juice, but if you're sitting around with STD infection or STI infections in your esophagus, your throat may be sore, but also over the years, it may be a whole incubus of germinated infections brewing. You don't get symptoms, you just get sore throat, and it can be brewing, and you don't even know. And a lot of men can carry it because guys get less symptoms anyway. If someone infected gives me oral, oh, but I don't give them oral, you can still catch gonorrhea. Yes, with the oral, see, this is how I look at the oral situation. I remember when HPV heaven first came out. That's the human papillomavirus, and I started teaching my kids about it. What I learned about HPV was, if you get the Gardasil shot, you give that to your daughters before they start having sex, you can kind of prevent them from getting HPV, which can cause cancer. But if a young man had oral sex on a young girl that had HPV and he kissed her, or he had oral, that germ can actually come on out. I mean, if it can turn to cancer, it's there. The infection is there. It can go somewhere. There's some of these diseases that you can get from skin to skin. Which one can you get? Skin herpes can get skin to skin, right? Skin to skin can give you the herpes simplex. You can get that herpes white rash and cauliflower looking bumps from skin to skin. For some women, you can get the herpes from vagina to vagina. You can also get chlamydia, vagina from your vagina, and gonorrhea, vagina. Okay? So, yes. All right. So, ladies, this is something you probably are not used to doing. Take your partner with you. My mom used to work with people with HIV/AIDS, and she did seminars, period, nigga. Okay. Don't be afraid, ladies, when you meet a new sexual partner, don't be afraid to say, let's use condoms. And don't be afraid to say, hey, let's go to the clinic together. Let's go to the clinic together and let's just get our blood work done. It's okay. All it's going to do is save a life. Just go get your blood work done. Even if he or she comes back with a positive test, go with that person to get their treatment, right? Make sure they get their treatment, because this may be your soulmate, but guide that person to get their treatment. That's the most important thing. And if you choose to continue to have protected sex, then so be it. But go with that person that you feel as though you may be spending parts of your life with, and make sure you guys are okay. All right? If they run away when you ask, that's perfect. Leave his ass or her ass where they at. Don't nobody want no stank penis going in their vagina. You don't deserve it, ladies. If you're a grown woman enough to say, listen, I love you, but before we take these condoms off, let's go consult with our physician. And do y'all also know, Almond, there are sexually transmitted tests that you can order. I'm going to get y'all the information. If you want to test you or your partner in your own home, they exist. Okay? If you want, I'm going to find them for you. They're home sexually transmitted tests. All right? Now, let's talk about HIV. Yes, they have instant at-home tests. Right. Google them, ladies. Google them. Now, let's talk about HPV. HIV. I'm sorry. HIV. Even at CVS and Amazon. Oops. Shout outs to Amazon and CVS. All right. All right. What is HIV and AIDS? Okay. What is HIV? HIV is a virus that causes AIDS. It damages your immune system, make it easier for you to get sick. HIV is spread during sex, but condoms can prevent or protect. All right, it can help. All right. Now, HIV is an infection that can lead to AIDS. HIV stands for Human Immune Deficiency Virus. It's a virus that causes breakdown. This is what they wrote. It's a virus that breaks down certain cells in your immune system, your body's defense against diseases that help you stay healthy. When HIV damages your immune system, it's easier to get really sick and even die from infections that your body could normally fight out. So let's discuss this. So HIV, which is a human immune deficiency virus, if you contract it, it's not saying that you necessarily will die from HIV, but they said the fact that the HIV damages your immune system, low T cells, right? It damages that, make that T cell count very low. It opens you up to get sick easily and get other infections easily that your body could normally fight off, and ultimately you can die from these infections and sicknesses that you get due to having HIV. Stuff that your body would normally fight off. The fact that your T cell count is low, you can get sick and die. It kills the white cells and turns them against your body. Thank you, King Wolf. T cell count is low. All right, so let's keep reading. About 1.1 million people in the U.S. are living with HIV, and more than 38,000 new infections happen every year. Most people with HIV don't have any symptoms for years and feel totally fine, so they might not even know they have it. Thank you, Nika. Thank you. All right. Now, once you have HIV, the virus stays in your body for life. Let me repeat that. Once you have HIV, the virus stays in your body for life. There's no cure for HIV, okay? But medicines can help you stay healthy. There are medicines that help you stay healthy. HIV medicines lowers or even stops your chances of spreading the virus to other people. Medications, all right? Studies show that using HIV treatment as directed can lower the amount of HIV in your blood so much that it might not even show up on a test. So sometimes you hear people, I've heard people say, I've tested negative, for HIV, and in the past they've tested positive in the past. And here it is. It's because of the medications that they're taking on time and as directed. It's basically lowering the HIV so much in their blood to where now when they're tested, they're going undetected because they stuck to the assignment, they understood the assignment, and they're taking their medication as directed, and now it's kind of not even detected. When this happens, you can't transmit HIV through sex. If you take this medication as directed, and the amount of HIV in your blood is so low that you now test negative, you can't transmit HIV through sex. So there you have it. So treatment is very important, you guys. Treatment is very important. Now, without treatment, HIV can lead to AIDS. But with medicine, people with HIV can live a long, healthy life and stop the spread of HIV to others. All right. Now, what's the difference I'm still ain't taking no chances either. Now, what's the difference between HIV and AIDS? Yeah, what Miss Diamond said. Guys, still use your condoms. Don't depend on this medication. Use your condoms. Try to protect yourself. All right. Take you and your partner down to a physician. Get tested. Get treated if needed. Make yourselves healthy. With all these diseases we're talking about. I didn't say that I was a medical physician. I made sure when we started this, I'm not posing as anybody's healthcare provider, anybody's nurse practitioner. I'm not saying who, what, when, where, how. I'm not giving you guys medical advice. All I'm doing is going on WebMD and reading facts. That's all I'm doing. Okay. This is just basically conversation with Empress night. All right. So all I can offer you guys is if you're feeling sick or if you have discharge or this or that, go and consult your physician. Right. This is awareness. Go consult your physician, your nurse practitioner, your primary physician, your gynecologist, or a local clinic. All right. Not your homeboys, not your homegirls, not your cousins. Don't say, let me borrow some of your pills. No. None of that. Well, if it's not a credible site, I'm also on the Planned Parenthood site as well. All right. So basically, if you feel as though you're reading something and it's not credible, again, consult your physicians. They practice medicine every day. Consult your nurse practitioner, consult your PA, which is your physician assistant, your local clinic, your gyno, the CDC. I'm on the CDC website as well. I'm using all these websites across the board to read the information. Thank you very, very much, Matrix. All right. So, see, a lot of you guys are so smart and educated. That's why it's good to take comments and questions and comments from the people in the comments. All right. So let's get into it. Now, what's the difference, guys? What is the difference between HIV and AIDS? So HIV is a virus that causes AIDS, right? So HIV is a virus that causes AIDS. AIDS stands for acquired immune deficiency syndrome. All right. HIV and AIDS are not the same thing, and people with HIV do not always have AIDS. All right. So we've already learned that with AIDS, you can get treatment, you can take medications, and you can probably test positive for HIV. And then in the future, if you take your medication as directed and you continue to take your test, you may show up to be negative in the future. All right. So AIDS is a little different. All right. So let's continue to read. HIV and AIDS are not the same, and people with HIV do not always have AIDS. HIV is a virus that's passed from one person to another person. But over time, HIV destroys an important kind of the cell in your immune system. All right. These are your T cells, which are also known as your CD4 cells. All right. HIV destroys these cells. They get the count and they mash them and they make the count lower. All right. That helps prevent you from infections. T cells help prevent you from getting infections. HIV harps on those and destroy them. What happens when they tell you that after y'all hook up? So scam likely. So what we recommend is using protection, number one. What we also recommend is if you feel, I feel as though AIDS is, and we'll get into that. Because AIDS is so serious. It's more of a highly stage. HIV is like stage 1. And if you treat it and take your medications right, your T count can come back up. But with AIDS, that's a whole nother level. That's pretty much like if you had to look at cancer stage 1, 2, 3, 4. If you got to AIDS, that's the highest stage. So I'm going to assume and I'm going to say that AIDS would be more worse than HIV. Now, as for scam likely, use condoms. Not only that, if you meet someone and you like this girl and you feel as though you're going to spend a lot of time with her, it's nothing wrong with you saying, hey, let's go to the clinic together. Let's get tested. It's nothing wrong with you asking her, can you bring your test results along with you? It's nothing wrong with you asking her, hey, last time you went to the doctor, when the last time you had a checkup, you want to go to the doctor together? That would be a great trip. You know how much respect that person would have for you to say, hey, let's go to the doctor together. I'm digging you. I want to, let's take a trip to the doctor instead of to Red Lobster or to the mall. Take a trip to the doctor or to your clinic, all right, and get some tests done, okay? Then go to Red Lobster to celebrate after, if that's your favorite place. All right, so we already understand that HIV destroys the most important cell in your immune system, that is your T cell. Your T cell helps protect you from getting infections, right? Now, T cells are also called CD4. When you don't have enough of these CD4 cells, your body can't fight off infections the way it normally can. Simple colds, the flu, pneumonia, your body can't fight them off because your T cell count is low due to you having HIV, right? Now, AIDS is a disease caused by the damage that HIV does to your immune system. So once your immune system is beat up, beat down, twisted, count is low by HIV, that's when AIDS come and give you a visit. It steps in, okay? Run for the hills if they refuse to have a doctor date, period, bam. Doctor date. I like doctor dates. Can you get both? Well, it all depends. Once you hit AIDS, do you still have HIV? Or have HIV graduated to AIDS? So let's continue to read. So once AIDS is the disease caused by the damage that HIV does to your immune system. You have AIDS when you get dangerous infections or have a super low CD count. Whoo! So once HIV is beat down on your immune system and your T cell count is very, 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 very low, that's when AIDS step in. AIDS is the most serious stage of HIV, and it leads to death over time. So yeah, you will have AIDS and HIV at the same time, because HIV is stage 1 and AIDS is the most serious step of HIV. So yeah, you will have them both. Yep. Without treatment, it usually takes about 10 years for someone with HIV to develop AIDS. So without treatment, it usually takes about 10 years for someone with HIV to develop AIDS. Treatment slows down the damage the virus caused and can help people stay healthy for several decades. Several decades. Several decades can be 20 years, 30 years. Those are decades. Now, how do you get HIV? HIV is carried in semen. Semen. C-U-M or semen. Okay? We all got some of that. Men, yeah, okay, or cum or whatever. Okay? Vaginal fluids, right? Anal mucus, blood, and breast milk. Let's repeat. HIV is carried in semen, vaginal fluids, anal mucus, blood, and breast milk. The virus gets into your body through cuts, sores in your skin, and through mucous membranes, like the inside of the vagina, rectum, and opening of the penis. You can get HIV from having vaginal anal sex, sharing needles or syringes for shooting drugs, piercings, or tattoos, getting stuck with a needle that has HIV-infected blood on it, getting HIV-infected blood, like through transfusions, or you can get HIV infected through semen, vaginal fluids, open cuts or sores on your body. HIV is usually spread through having unprotected sex, using condoms and or dental dams every time you have sex, and not sharing needles to protect you and your partner from HIV. If you do have HIV, treatment can lower or even stop the chances of spreading the virus to other people during sex. If you don't have HIV, there's also a daily medicine called PrEP that can protect you from HIV. I heard on this app once, there was a young man here that goes out and have a lot of men that come to his hotel room. And I remember him saying, yeah, I take PrEP. I take PrEP every day. So it led me to believe that all these sexual partners that you have coming in and out of your hotel room, you're having unprotected sex with them. And so you are taking a daily medicine called PrEP that protects you from getting HIV. I remember someone on this app, and I won't say that person's name, that mentioned that. Yeah. HIV, there's a lot of young individuals on this app that takes PrEP. Yep. Yep. HIV can also be passed to babies during pregnancy, birth, or breastfeeding. A pregnant woman with HIV can take medicine to greatly reduce the chance that her baby will get HIV. All right. HIV isn't spread through saliva or spit. Oh, look at that. Not spread through saliva or spit. So you can't get HIV from kissing, sharing food or drinks, or using the same fork or spoon. HIV is also not spread through hugging, holding hands, coughing, or sneezing. And you can't get HIV from a toilet seat. A long time ago, some people got HIV from infected blood transfusion, but now giving or getting blood in medical centers is totally safe. Doctors, hospitals, and blood donors centers don't use needles more than once, and donated blood is tested for HIV and other infections. That's good. Okay. So those are some, hi M69, thank you. So those are some facts on HIV. So what have we covered so far? So far, we've covered HPV. Thank you. HPV, human papillomavirus, which can turn to cancer. Herpes, right? The genital warts, herpes warts. So, okay. We also talked about chlamydia, gonorrhea, and now HIV. So, what are we going to move on now? I think we should move on to syphilis. Do you all agree? I agree. So, let's move on to syphilis. Now, any questions? Oh, we have someone that's want to come up and have a question. All right, so come up, El Beauty. All right, El Beauty has a question or a comment. Hello, El Beauty. Hi, El Beauty. Do you have a question? Please ask us a question, El Beauty. She don't have a question. This this that talk that make you think twice for real. Yep, strap up, M69. But yeah, she was sleeping. That's my Aunt Beauty. She's resting, y'all. All right, so let's get into syphilis. Right, this is that talk. Anybody have a question before we move on? All right, so far we talked about human papillomavirus infection. We talked about genital herpes, chlamydia, gonorrhea, HIV, AIDS. Now we're going to cover syphilis. All right, are we all in agreement? All right, I'm moving on. Yes, all right. Well, let's get into it. Okay. Anyone have any questions or comments or anything? This is your time. This is awareness for all of us. So this conversation is for all of us, all right? Not just for me, not just for you, but all of us, all right? Hmm. All right, so let's talk about syphilis. Maybe one day we can talk about menopause. Yeah, we can talk about menopause. Absolutely. All right, so let's get into syphilis, right? What is syphilis? All right. So syphilis is a common bacterial infection that's spread through sex. Syphilis is easily cured with antibiotic medicine, but it can cause permanent damage if you don't get it treated. So that is look at this, y'all. Syphilis is easily cured with antibiotic medicine, but it can cause permanent damage if you don't get it treated. Now, how many people thought that syphilis was not curable? How many? All right, do we have okay, Sitting Pretty has a question. Sitting Pretty, I'm bringing you up. Do you mean to be in the join box, Sitting Pretty, or no? Because if you don't know, I'll bring you up in the join box. I'm just trying to warn you. If you're not supposed to be in the join box, hit that box and take yourself out. All right, Sitting Pretty is in the box. Now she's gone. All right. Hi. All right. So okay, again, syphilis is easy cured, but who thought syphilis? Who knew? That's my daughter. Ross is my daughter. Who knew that syphilis was curable? Hey, see y'all. Who knew that? That if you take your antibiotic medicine properly, it can cure. All right, so let's talk about the damages. Syphilis is serious. All right, syphilis is serious. Hello, Henny. But it can be cured. Syphilis is a really common STD. Syphilis is spread through vaginal, anal, and oral sex. Mm-hmm. Syphilis causes sores on the genitals, okay? And they're called like canker sores. The sores are usually painless, but they can easily spread the infection to other people. So when you have those syphilis breakouts, you can spread it to other people, all right? You get syphilis from contact with the sores. You can get it from contact with the sores. A lot of people with syphilis don't notice the sores and feel totally fine, so they might not know they have it. Syphilis can infect your vagina, anus, penis, or scrotum, and sometimes your lips and mouth. You can help prevent syphilis by using condoms and or dental dams. Every time you have sex, syphilis can be easily cured with medication if you treat it early. But without treatment, it leads to really serious permanent problems like brain damage, paralysis, and blindness. It can paralyze you, blind you, and leave you with brain damage. Can you imagine? That's why STD testing is so important. The sooner you know you have syphilis, the faster you can get rid of it. All right, that was good. And I'm going to read that again. Syphilis can be easily cured with medication if you treat it early. But without treatment, it leads to really serious permanent problems like brain damage, paralysis, and blindness. That's why STD testing is so important. The sooner you know you have syphilis, the faster you can get rid of it. How do you get syphilis? Okay. Syphilis is spread from sexual, skin to skin contact with someone who has it. The Tuskegee experiment was a dirty, dirty experiment. Dirty, dirty. If a lot of you guys are not familiar with the Tuskegee experiment, this is where I think it happened in Alabama, of course, where these gentlemen were all brought into clinic to get X amount of dollars for an experiment, a plain old experiment about just health or whatnot. They didn't know that there was a control group that all black men, and the control group was giving syphilis. They were given this disease on purpose, injected in their bodies, and not given the real medication to treat it, not knowing that they were injected with the syphilis. And they did it to our black man in Alabama for little to no money on pennies on the dollar. So that was a Tuskegee experiment. Yep. All right. So let's get into it. And the funny thing is, this could have been cured, and these guys all left to just rot and become sick. with no vaccination, not the proper medication. Mm. All right, so syphilis isn't spread through casual contact. Okay, I'm sorry. You can get it when your vulva, vagina, penis, anus, or mouth touches someone with syphilis sores, usually during sex. Syphilis can be spread even if no semen or no one ejaculates, right? Syphilis isn't spread through casual contact, so you can't get it from sharing food or drinks, hugging, holding hands, coughing, sneezing, sharing towels, or sitting on toilets. The main ways people get syphilis are from having vaginal sex and anal sex, okay? It's less common to get it when having oral sex. Look at that. But it can happen. Syphilis is also very easy to give to other people in the beginning when there are sores. But lots of people don't even know they have syphilis because they don't notice the sores. So, ladies, this is what I'm talking about. Get that mirror sometimes. Take a look between your legs. Take a peek, open up, look around. Even if you're dating another female, look down between that female's legs, look down between each other's legs. You're looking for little sores, or little spots, dots, humps, or bumps that you don't even know is there. Same with men. Check that female out, gentlemen. Not only that, have her check the inside of you and around your head area. Check it out. Guys, if your testicles and balls are sore, go and seek medical attention. Y'all need to be checking each other out. Y'all need to be down there checking each other out, questioning what this bump, hump, dump. Oh, it's a hair bump. Is it this? What is it? What is it? Okay. Now, the main ways people get syphilis are from having vaginal sex. We said that, and anal sex. It's less common to get it from having oral sex, but it can happen. Syphilis is very easy to give to other people in the beginning when there are sores, but lots of people don't even know that they have syphilis because they don't notice the sores. Using condoms every time you have sex is one of the best ways to help prevent syphilis. Okay, even if you and your partner seem totally healthy, use condoms, or you guys should be going to get checkups together. Okay, what do we call that? What kind of date did we call that? Bam Bam. I like that date, what Bam Bam used. What kind of date we using? A checkup date, a medical date? What kind of date was it, Bam Bam? A doctor date. I like that. You guys all should go on doctor dates together. I like that. A doctor date. A mother can also pass syphilis to a baby during pregnancy and childbirth. Which can be dangerous. This is called congenital syphilis. Ooh. Congenital syphilis. All right. So what is congenital syphilis? Thank you, Bam Bam. So let's talk about it. This is CS. It happens when syphilis is passed to your baby during pregnancy. The impact of CS on your baby's health depends on how long you've had syphilis and when you get treated for it. So it's important to get tested for syphilis at your first pregnancy checkup. Your nurse or doctor can help you decide how often to get tested and for which infections during your pregnancy and give you treatment if you test positive. This form of syphilis, congenital syphilis, can also cause you to have a miscarriage. Well, let's see. Early delivery or stillbirth. It can also cause your baby to have a low birth weight or die shortly after birth. Babies born with this type of syphilis can have deformed bones, anemia, enlarged livers, and spleens, yellowing of the skin or eyes, blindness, deafness, meningitis, skin rashes. Usually these problems develop in the first few weeks after birth, but they can also happen years later. There is treatment for CS, Nika, but your baby will need to be treated right away so they can avoid developing serious health problems. After testing and examining your baby, your nurse or doctor will recommend treatment. Treatment for congenital syphilis is antibiotics. Sometimes they only need one dose, but sometimes they need to be treated while staying in the hospital for 10 days. All right, guys. So those are your updates on syphilis. All right. Syphilis can be cured if you take your medication. Syphilis can be passed if the sores touch skin, vagina, anus, okay, area. Syphilis can infect your vagina, anus, penis, or your scrotum. How do you get syphilis? Skin-to-skin contact with someone who has it, okay, with the sores. During sex, unprotected sex, also with semen, okay, oral, anal. All right. If a mother has syphilis and that she's not treated, she can pass something called congenital syphilis to her unborn child. This child can die from it, be blind from it, have brain damage from it, enlarged liver, spleen, yellow skin or eyes, blindness, meningitis, skin rashes, and deafness. So, ladies, check yourselves out. If you go to the doctor and the doctor says that you need to take medication that's going to treat an STD or STI, take your medication. All right, it'll keep you healthy and strong, and it also save your child, and it can also save your partner. All right. So that was syphilis, guys. We can cover. Let's see what else we can cover. Maybe we can cover. Oh, maybe two more. I need to be live. I need to do 2 hours, don't I? All right, so let's keep it going. So we covered chlamydia, genital warts, gonorrhea. Ooh, we didn't cover hepatitis B, y'all. Ooh, let's cover hepatitis B. Okay, what did you say about HIV and HPV? All right, so it's HPV. I didn't say anything about HSV, but HPV is the human papilloma virus. Okay, it's HPV is usually harmless and goes away by itself, but some types can lead to cancer. That's what we said about HPV. Did you want to hear more about it, or we can move on to hepatitis B? Are we moving on to hepatitis? Yes or no? What are we doing? Hey, fruitful. All right, so we're moving on to hepatitis, right? Okay, so let's move on to hepatitis. So hepatitis B is a virus that can cause liver disease, which is spread through sex or sharing personal hygiene items like razors and toothbrushes. Woohoo! Now look at that. That's a fun fact that I didn't even know. So let's get into it. Hepatitis B, everybody. All right, so what is hepatitis B? Hepatitis B is an infection that can cause liver disease. It's spread through sex. You can protect yourself by getting a hepatitis B vaccination and using condoms. How to prevent hepatitis B? Hepatitis B is a liver infection caused by a virus called the hepatitis B virus, or HBV. It can be serious, and there's no cure. There's no cure for hepatitis B. But the good news is it's easy to prevent. You can protect yourself by getting a hepatitis B vaccination, the vaccine, you guys, and having safer sex. Most of us have the Hep B vaccine. If you have oral, anal, and vaginal sex, use condoms, okay, and dental dams to help stop the spread of hepatitis B and other STDs. How do you get hepatitis B? Let's get into it. Hepatitis B is really contagious. It's transmitted through contact with semen, vaginal fluids, and blood. You can get it from having vaginal, anal, or oral sex. Remember, condoms can help prevent this. All right, sharing toothbrushes and razors, because blood is carried on toothbrushes and razors that can carry hepatitis B. Sharing needles, King Wolf, for shooting drugs, piercing, and tattoos. Getting stuck with a needle that has Hep B virus on it. Okay. How about this one? Hepatitis B can also be passed to babies during birth if their mother has it. Hepatitis B isn't spread through saliva, which is spit, So you can't get hepatitis B from sharing food or drinks or using the same fork or spoon. Hepatitis B is also not spread through kissing, hugging, holding hands, coughing, sneezing, or breastfeeding. All right. And there are other types of hepatitis. Yes, they are. The most common kinds of hepatitis are hepatitis A, hepatitis B, and hepatitis C. Hepatitis B is the kind that is most likely to be spread through sex. All right. Hepatitis C, if you guys really want to know, let's get into it. Hepatitis C is a virus that can cause liver disease, sometimes called Hep C or HCV for short. Hepatitis C can be a mild illness that only lasts a few weeks or months, or a serious chronic condition that lasts your whole life. Hepatitis C can lead to serious illnesses like cirrhosis of the liver, liver cancer, and can eventually kill you if left untreated. Right? Hepatitis C transmissions is transmitted through blood, most commonly from needles, syringes used for taking drugs. But Hep C can also be spread from tattoos or piercing needles, the needles being properly cleaned by accident in a medical setting, from blood transfusions and organ transplants performed prior through 1992. Since 1992, they've been testing bloods, and no one used dirty syringes or needles, okay? And from a parent to their baby or during childbirth. That's Hep C, you guys. Although it's rare, hepatitis C can also be sexually transmitted. Condoms will work to prevent spreading hepatitis C during sex. Talk with your doctor or nurse about getting tested for hepatitis C if you think you may be at risk. Now, these are some of the symptoms, all right? This is hepatitis C. You might not always have symptoms, but these are some of the symptoms, okay? Now, after you expose, these symptoms can arise 4 to 12 weeks after being exposed, all right? So early stages, which is the acute stages of hepatitis C, includes tiredness, pain in your belly, poor appetite, jaundice. That's when your eyes and skin turn yellow. Clay-colored stool. Instead of it being brown, it may be grayish, clay color. Dark urine, very dark urine, okay? Fevers, joint pain, nausea, and vomiting. Any of these you guys think you may have? Consult your physician. Call up your physician, your gynecologist, your clinic, your nurse practitioner, your PA. Call them and go get some tests done. All right. For some people, hepatitis C goes away without treatment after about 6 months, but for most people, Hep C turns into chronic, lifelong conditions. Chronic hepatitis C rarely has symptoms, but most people find out that they have hepatitis C when they're diagnosed with advanced liver disease, okay? You got issues with your liver, just go get a test, okay? Advanced liver disease, all right? That's why it's important to get checked for hepatitis C if you think you may be at risk, guys, all right? Anybody that's done intravenous drugs, needles and this and that, all that weird stuff, go get yourself checked out, especially if you share syringes with different people. Hepatitis C treatment typically consists of antiviral medications to reduce the amount of virus in your system. There are also new treatments that may cure it. Your doctor or nurse will likely recommend that you avoid drinking alcohol and taking certain medications that may harm your liver. So when you have Hep C, remember, these hepatitis B and hepatitis C, they can cause liver disease. So you should be on no alcohol when you have these diseases because you're helping yourself die faster. Okay? All right, so let's move to the next. STD, which is sexually transmitted disease, or STI, which is sexually transmitted infection. All right, so the next one we have here will be, we have option, guys, okay? So we've covered so far chlamydia, genital warts, gonorrhea, hepatitis B and C, herpes. Well, we didn't cover herpes. We covered genital warts. We didn't cover herpes. We covered HIV and AIDS. We covered HPV, human papillomavirus. We covered syphilis. Now we have pubic lice. we have scabies, and we still have herpes. So which one you want to talk about now? We have herpes left, pubic lice, scabies, oh, and trichomoniasis. We have trichomoniasis. Which one? Trichomoniasis, pubic lice, okay, scabies. Let's go to scabies, Bam Bam. Thank you very much. Scabies are tiny parasites that cause itching. Pass through skin-to-skin contact, usually during sex, and it can be cured, all right? So scabies like little people that live on you. What is a scabie? Itchy skin condition, tiny parasites, pass through skin-to-skin contact during sex. Scabies isn't dangerous and can be cured. So let's talk about it. Scabies is a skin condition. Scabies is a skin condition, and it's pronounced scabies. All right. Now, it's caused by scabies mites. Tiny insect-like parasites that infect the top layer of your skin. Scabies cause rashes, irritation, and a ton of itching. Woohoo! It's easily spread to other people during skin-to-skin touching. Is it true if you pass from a bar of soap? Well, let's see. Hey, Royal Royce. It does say skin-to-skin touching, but we can continue to read about the soaps. Let's continue to read so we can confirm. Hello, mother. Hello, daughter. Scabies mites bury underneath the top layer of your skin and lay eggs. They lay eggs in your skin. The eggs lead to more mites, but most people with scabies only have about 10 to 15 mites on their bodies at a time. The mites are super small, so you may not see them, but you'll probably notice the itching and irritation they cause. Scabies can be very, very uncomfortable, but it's usually not dangerous. It can be cured with medication, creams, or pills. How is scabies contracted? Here's your answer. Scabies is spread by direct skin-to-skin touching. This usually happens during sex, especially when your bodies are touching or close for a long time, like if you sleep in a bed together. Most adults get scabies from sex, but you can get it other ways. Scabies can spread to other people in your home, and it's common in crowded places. Woohoo! That may have lots of close skin contact, like nursing homes, prisons, child care places. You can sometimes get scabies from sharing an infected person's clothes, towels, bedding. Yep. It's very hard to get scabies from quick casual touching, like handshakes or hugs. You also can't usually get scabies from toilet seats. Most of the time, it takes a lot of close personal contact and with infected persons of scabies for it to spread. Any questions on scabies? Anybody want to come up and have a question on scabies? Do you guys want to know the symptoms of scabies? Do you want to know how to treat scabies? Do you have any questions? Oh, we have, let's see if we have someone in the box that have a question. Famous Royce, participation is on fleek. Hello. I'm wonderful. Thank you for joining the conversation with Empress. This is our Women and STDs panel. Do you have any questions? We've covered so many STDs tonight. Well, casual contact, they exit out. But just say this, scabies are curable, okay? And here, what are some of the symptoms? And how about, let's talk about how can you prevent from getting them, or how do I treat scabies? So say, for instance, you were walking in a crowded room and you was on somebody and the scabies are on you now, and you're home itching and scratching because scabies live on the top layer of your skin and also lay eggs. So you're scratching and scratching and you don't know what the hell is going on. So basically, scabies is cured with pills or medicated creams. It'll kill the mites. It'll kill the eggs. All right. So you need a prescription from a doctor for scabies treatment. All right. So again, scabies is treated with prescription medicine called scabicide. Yep. Scabies is treated with a prescription called scabicide. Scabicide kills scabies, mites, and eggs. It usually comes in the form of a cream or a lotion. You rub the scabies cream on your body from your neck down to your toes, then wash it off after several hours. So basically, you will put this scabies cream on you. You will let it soak. You will let it marinate so it can get into your skin and kill the mites and the eggs. And after several hours, you are then able to take a shower. All right. Now, sometimes your nurse or doctor may prescribe a pill for you to take instead. Make sure to carefully follow your doctor's or nurse's directions and the directions on the package. Mm-hmm. Scabies. All right. Is that your question, ma'am? We've all right. So we've covered a lot of STDs. If you have more questions about STDs, we've covered. We did cover a lot of STDs like syphilis, HIV, AIDS. We've covered genital warts. We've covered chlamydia and gonorrhea. Maybe people are having unprotected sex. Maybe people are having a lot of intravenous, like drug interaction where they're changing needles with each other. Maybe people are just living carelessly, but I don't know. I can't answer that. So you have questions, Bam Bam, about hepatitis. We cover hepatitis B and C. Any questions about hepatitis? We learned that they both are liver diseases. They can cause swollen liver. Also, you can pass these diseases to your unborn child. Okay. What else would you like to know about hepatitis B and C? Okay. So are we going to move on to the next STD or STI? STD is sexually transmitted disease. STI is sexually transmitted infection. So can we move on now? So we're moving on. All right, so the ones that we have left, we just covered scabies. So now we have to talk about herpes, pubic lice, and trick. All right. So, Miss Royce, do you, if you're gonna sit there and be quiet, or I mean, you can take a seat and stay quiet if you. And then when you have a question, you can just allow yourself to be off mute and ask the question. Is that okay? Thank you. All right. Now, anybody else have a question or want to basically indulge in this conversation, feel free to come up. We have a couple of more minutes. So we're going to cover another STD. All right. So let's go back. All right. So this is what we have left. Herpes, pubic lice. Well, actually, pubic lice and trichomonias. Which one? Trichomonias is a major cause of vaginitis. It's very common and easily treated. And then pubic lice is crabs. Pubic lice is crabs, small parasites that attach to the skin and the hair near the genitals. easy to get rid of with treatment. You can get it at the drugstore. What are we talking about? And then you have herpes. This is the STD that infects your mouth and your genitals, causes blister sores. There's no cure, but symptoms are treatable. What do you think? Herpes, no cure, treatable. Pubic lice, crabs, all in your genital area, and trick is vaginitis. Which one would you like to hear about? Let's go. Okay, herpes for $10, Alex. Let's go in. All right, so let's take this a little bit serious. Now, what is herpes? Herpes is a common virus that causes sores on your genital and your mouth. Herpes can be annoying and painful, okay? But it usually doesn't lead to serious health problems. All right, so herpes is a common infection. Herpes is a super common infection that stays in your body for life. It stays in your body for life. All right, more than half of Americans have oral herpes, and about 1 out of 6 Americans have genital herpes. So chances are a few people you know are living with herpes. So basically, if it's 449 people in this live, based on the statistics, if it's 449 people in this live, 200 of you might have herpes based on the stats. Mm-mm-mm. So there's chances are a few people you know are living with herpes. Mm-hmm. So herpes is caused by 2 different but similar viruses. Herpes simplex virus 1 type and herpes simplex virus 2 type. All right. Both kinds, all right, both kinds can make sores pop up and on around your vulva, mm-hmm, vagina, cervix, anus, penis, and sternum, your butt, your inner thighs, lips, mouth, throat, and rarely your eyes. You can have herpes around your eyes. Okay? Herpes is spread from skin to skin contact with infected areas, often during vaginal sex, oral sex, anal sex, and kissing. Herpes causes outbreaks of itchy, painful blisters and sores that come and go. Many people with herpes don't notice the sores or mistake them for something else. So they might not even know they're infected. You can spread herpes even when you don't have any sores or symptoms. Guys, protect yourself. Have a doctor date, right, Bam? Have a doctor date. If you're meeting someone new, go have a doctor date so that you guys know what you need to treat yourselves with. You can save each other or you can save an unborn child. And remember what gonorrhea said. Gonorrhea said, if you don't treat me, I will keep you from having kids. If you don't treat Mr. Gonorrhea, he's going to keep you from having kids. You will be infertile. Okay, guys? If you want your liver swollen and big and fat like this, go and get yourself tested for hepatitis B and C. All right, cirrhosis of the liver, it's dangerous. You need your liver for filtration. Go and get this stuff checked. All right. Now, let's get into it. There's no cure for herpes, but medication can ease your symptoms. It's lucky Libra. Yep, so important to know your status. Have a doctor date with your partner so you guys can know your status. Doctor dates are important. If you meet someone and you're feeling that person and you feel as though you guys want to take off condoms, let's have a doctor date. Let's just go get tested for everything at the clinic. All right? And whatever you have, I'm not going to judge you. Don't judge me, but let's get treated for it and get it all out of our bodies. So now, if we do choose to have unprotected sex, or if you choose to put your mouth on my private parts, we're protected. It's safe. It's safe. Doctor dates or tell them to dip off. Period, bam, bam. Okay? Now, there's no cure for herpes, but medication can ease your symptoms and lower your chances of giving the virus to other people. And the good news is Outbreaks usually become less frequent over time. Those outbreaks, those bumps and those sores and those blisters that really hurt and they're painful, as you get treatment and take your medication, they can become less frequent over time. Even through herpes can sometimes be uncomfortable and painful. It's not dangerous, all right? People with herpes have relationships. They have sex and live perfectly healthy lives, all right? Now, what's the difference between genital herpes and oral herpes? Before my husband and I got married, we went on a doctor date together. Beautiful. It's sad people get offered when people ask them to do it. It's sad people get offended when people ask them to do it. They do get it, love. They get offended. And they don't, because you know what? That person is closed-minded and ignorant. You don't understand. That is a very adult, respectful, and very, very, very mature thing to do. It's ask for a doctor date. Don't deal with nobody with no small mind, because small minds can really kill a friendship. If they get offended, they aren't for you. I agree. Now, what's the difference, you guys? Are scared to know their status. That's true, Pip Lady. That's true. Now, let's get into it. Because there are two different kinds of herpes simplex viruses, herpes simplex virus 1 and herpes simplex virus 2, that can live on many body parts. Lots of people are confused about what to call these infections, but it's actually pretty simple. All right, so let's get into it. When you get either HSV1, herpes simplex virus 1, or HSV2, which is herpes simplex virus 2, in or around your lips, mouth, and throat, it's called oral herpes. Okay? Or herpes sores are sometimes called cold sores or fever blisters. Okay, we spoke about that earlier. The cold sores or fever blisters is a form of herpes simplex viruses. Now, herpes simplex 1 usually causes oral herpes, all right? And herpes simplex 2 usually causes genital herpes. So herpes simplex 1 is the one that's around your oral, throat, mouth. Herpes simplex 2 is where? Where is herpes simplex 2 usually found or causes? Where? Anyone in the comments that's listening? Herpes simplex 2 usually causes what? Your genital region. Genital herpes, okay? All right. Now, each strand prefers to live on its favorite area. So it'll live on its favorite area. But it's totally possible for both types of herpes simplex to infect either area. For example, you can get herpes simplex virus 1 on your genitals if someone with a cold sore on their lips gives you oral sex. You can get a cold sore on your vagina or your penis. You can get a cold sore on your vagina or your penis if somebody with cold sores in their mouth goes down on you. And you can get herpes simplex 2 in your mouth if you have oral sex with someone with herpes simplex 2 on their genitals. Guys, you're putting yourself in risk if you don't examine your body parts and if you don't examine your partner's body parts. Look for different things that look abnormal: white spots, brown spots, yellow spots, bumps, humps, and tumps. Look for that stuff. Examine, ask questions, okay? Nothing should be seeping, leaking, smelling, itching, or pussing out of your genitals, okay? All right, 4.915 million people have herpes, ages between 15 through 49. Remember what I told you earlier? That means somebody you know, there got to be somebody you know has herpes. Bumps, humps, and stumps. Yes, Darrell. Yes, baby. Okay? Isn't that something? So if you have a cold sore on your mouth and you perform oral sex on someone, you can give them those cold sores. If you have genital herpes on your genitals and somebody put their mouth on you, you can now put genital herpes in that person's mouth. How do you get herpes? Herpes is easily spread from skin to skin contact with someone who has the virus. You can get it when your genitals and or your mouth touch their genitals and or mouth, usually during oral, anal, and vaginal sex. Herpes can be passed even if the penis or tongue doesn't go all the way inside the vaginal area, anus, or mouth. It can just touch the tip. You don't have to ejaculate or cum to spread herpes. All it takes is some quick skin to skin touching, and you can easily get herpes from kissing someone who has oral herpes. Yep. 1.2 million people in the USA have HIV. Thank you, Heaven Sent. So, the skin on your genitals, mouth, and eyes can be affected easily. Other areas of the skin may be infected if there's a way for the herpes virus to get in, like through a cut, a burn, a rash, or other sores. You don't have to have sex to get herpes, you guys. You don't have to have sex to get herpes. Sometimes herpes can be passed in non-sexual ways. Like if a parent with a cold sore gives you a peck on your lips. Most people with oral herpes got it when they were a kid. A mother can pass genital herpes to a baby during vaginal childbirth, but that's pretty rare. You can spread herpes to another part of your body if you touch a herpes sore and then touch your mouth, genitals, or eyes without washing your hands first. You can also pass herpes to someone else that same way. Herpes is the most contagious when sores are open and wet because the fluid from the herpes blisters easily spread the virus. But herpes can also shed and get passed to others when there are no sores and your skin looks totally normal. Most people get herpes from someone who doesn't have any sores. It may live in your body for years without causing any symptoms. So it's really hard to know for sure when and how you got it. That's why so many people have herpes. It's a pretty sneaky infection because the virus dies quickly inside the body. You can't get herpes from hugging, holding hands, coughing, sneezing, or sitting on toilet seats. Blood check, yes, stay home. Or doctor dates, Heaven Sent, period. All right, now we have option if you want to know a little bit more about herpes, living with herpes, or how do I get treatment for herpes. I wonder if dogs and cats can get these issues and spread it among themselves. Yes, dogs and cats can get a lot of diseases. Absolutely. Absolutely. I know dogs and got some cancer, some sexually transmitted disease. Yes. Thank you. I pop my ish. Thank you. All right. So, do you guys want to know how do I get treatment for herpes, or should I get tested for herpes? Which one? Treatment, or should I get tested? How do they look? Or you want to cover both? All right. So let's start off with what does genital herpes look like? Okay. Now, many people who have genital herpes don't show symptoms, or the symptoms are so mild they don't notice them. All right. So they might not even know it they have it. What herpes does cause symptoms. The most common one is sores and blisters that show up on the body parts where the infection lives. All right. This is called an outbreak. Okay. What does the beginning of a genital herpes look like? Right before an outbreak, you might feel tingling, itching, or burning around the area where the sores will happen. You might also notice some small discolored or white bumps starting to form. Genital herpes sores can appear on your vagina, your vulva, your cervix, your penis, your scrotum, those are your balls, nuts, anus, or upper thigh. Okay, no bang bang grim, no sir. All right, so genital herpes outbreaks usually look like a cluster of itchy or painful blisters filled with fluid. I'm going to wait until Royal Royce get back because she's probably going to want to hear this. She's always interested in health topics and talks. She is actually my daughter, if you guys don't know, and I've always talked to them about sexually transmitted diseases and treatments and cures. I've always spoke, even when they were little girls. Yeah, I always thought that was important. So we're going to give her a minute. Now, any questions right now in regards to the beginning stages of genital herpes? We've already found out that they look like, or they may feel tingling, any itching, any burning around your mouth or your genital area. If so, please consult with your physician. It could be your primary care. It could be your gynecologist. It can be your nurse practitioner. It can be your physician assistant, or it can be someone at your local clinic. Okay. Now, I don't know if her phone is dying or not, but maybe she can hear us. We're going to go ahead and move along a little bit. All right. So again, genital herpes outbreak usually look like a cluster of itchy or painful blisters filled with fluid. Oh, she can hear us. Okay. Can she hear? She's on the phone. All right. Filled with fluid. They may be different sizes and appear in different places. Now, the blisters break or turn. I'm enjoying this awareness gathering. Thank you, Bam Bam. Thank you so much. Now, they may be different in sizes and appear in different places. The blisters break or turn into sores that bleed or ooze a whitish fluid. Woo. As the outbreak becomes, oh, Royce, you missed it. Genital herpes, real quick, okay? Genital herpes outbreak usually looks like a cluster of itchy or painful blisters filled with fluid, all right? They may be different in sizes and appear in different places. The blisters break or turn into sores that bleed or ooze a whitish fluid. Okay, I'm repeating it for you. As the outbreak comes to an end, the herpes sores will scab over and eventually go away. The sores can take a week or more to heal. But before you get those sores, you're going to get a tingly, itching, or burning around the area, like your genital areas. You might also notice some small, discolored, or white bumps starting to form. And that's when an itchy, painful blisters filled with fluid. Ooh, okay, all around, yes, the real, all around that area, okay? Now, famous, what do you think causes them to flare back up after they're gone? So what I did read about the flare-ups is some people don't get flare-ups. Some people may get one or two, and some people get them on a regular basis. I wonder if there's an odor. Okay, let's see. Now, symptoms of symptoms of genital herpes look different at different stages of the outbreak. Okay, so let's talk about it, cupcakes. They usually start out mild but get worse as the outbreak goes on. You can also have flu-like symptoms during the outbreak, like a fever, chill, body aches, and swollen glands. Herpes outbreaks look different in different people, and your next outbreak might look different from the last one. Your genital herpes outbreak is usually the worst one. Oh, your first one is usually the worst one. Oh my God. If you do have more outbreaks, they're usually shorter and less painful, okay? Most people get fewer outbreaks over time, and some people stop having them altogether. There are no way to know for sure if you'll have another outbreak or how often you'll have them. It's different for every person. Your nurse or doctor can give you herpes medicine to help prevent or treat the outbreaks, and there are ointments that can make your sores heal faster and hurt less. Herpes sores can look like another skin problem, like acne, contact dermatitis, or ingrown hairs. So the only way to know for sure if you have herpes is to see a doctor, you guys, like the ones at your local clinic, Planned Parenthood, doctor's office, emergency room, gynecologist, okay? Now, what does genital herpes look like when it's healing? All right. As your herpes outbreak comes to an end, your herpes sores will begin to crust over, scab like a small cut, and eventually go away. The sores can take a week or more to heal. All right. And your nurse or doctor can give you herpes medications to help you prevent or treat an outbreak. And there are ointments that can help you as well. What do I do if I have genital herpes? If you have genital herpes, some people have a lot of fears and misconceptions about herpes, but it's a common STD, y'all, sexually transmitted disease. It can be painful and uncomfortable during outbreaks, but it's not deadly and it doesn't cause serious health problems. So if you have genital herpes, try not to panic or feel too bad about it. Millions of people are living with herpes, okay? So you're not alone. And even though there's no cure for herpes, there are plenty of ways to treat the symptoms and manage the infection. Your doctor will tell you about the best treatment options for your situation. Okay? That was herpes, you guys. So that was herpes. Now, any questions? Any questions on herpes? Anybody want to come up and ask a question in regards to herpes? So we have all these beautiful ladies in this room. We have Famous Royce, we have Brown, Baby Shark Dennis, L Beauty, Lana, Cahill, Bam Bam, Fruitful, The Real, Pip Lady, Mushy, Katrina, Caramello, Cupcake, SBS, E Squad, Sweet Peach, Mama Billions, Forever Yours, Pretty Girl, Lady Virgo, Ari Nicole, Lady Slick, T Bless Black, Riri, Veg for Life, Hey Beauty, Butterfly, Star Thomas, Nene, Big Dreams, Return on the Man. We have all these beautiful ladies in the room, and no one has a question. Hey. All right, so if we don't have a question, we're going to move on. Now Empress calling me out. Period, Ari Nicole. Out, I've called you. How contagious is it if the person is on medication? Ooh, that's a good question. So now, but just remember, on herpes, you can't cure it. So even if they're on medication, the medication is not to not let you get it. The medication is to soothe the outbreak. So this person still has herpes. Remember, herpes is not curable and will live in your body forever. So even if you're on medication, you're not on medication for somebody else not to get your herpes. You're on medication to soothe those outbreaks, that those pus-filled sores. That's what you're on the medication for. All the statistics in seniors living with STDs going down. I haven't checked on the stats for senior citizens living with STDs, but we can pull up stats so you can give it to someone else. Exactly, Mama Billions. All right, stats on senior citizens. Stats, STDs, seniors. Yeah, we're not talking about seniors now. I don't want to get too thrown off our topic, but which group has the highest STD? Do old people have a lot of STDs? Do retirement communities have STDs? What do the elderly? What's the elderly? According to the CDC, the Centers for Disease Control, STIs have more than doubled in the past 10 years among ages 65 and over. So STIs have more than doubled in the past 10 years among United States adults aged 65 years and older, Cupcake. It's almost doubled in the last 10 years. Yes, ma'am. And that's from the CDC. Big dreamer, don't be laughing at old people. They be getting it on too, but they need to protect themselves. You know why? They're in those nursing homes doing things. They're in those nasty nursing homes doing things to each other with no protection. Nobody ain't watching Tom and Judy at night when they playing charades and when they playing matching and playing Jenga. When everybody going back, they think they going to the cafeteria to get some Jello, and they going, somewhere else. Well, the workers too, but so that means they will have to. I don't know. Ooh, for us, there's a lot of senior citizens touching each other. We get so many videos with seniors and stuff. Thank you. Well, not the workers. Well, it can be the workers raping people that are just lying there, but them seniors be getting it on with each other, honey. They be getting it in. Yeah. So that was genital herpes, everyone. So now let's see what we have left. We have pubic lice, which is crabs. Pubic lice, which is crabs. That sounds so funny to me. Pubic lice, which is crabs. So we have pubic lice and we have trichomoniasis left. Which one are we doing? Pubic lice or trichomoniasis? Should I choose? Let's do pubic lice. Pubic lice, aka crabs, they're small parasites that attach to the skin, all right, and the hair near your genitals. Crabs aren't dangerous and they're usually pretty easy to get rid of. All right, so let's talk about crabs. So crabs are different from scabies. Auntie, you looking cute talking about STDs. Thank you. So we spoke about scabies earlier. Remember, scabies live under your skin. They hatch eggs, but they're easy to get rid of. Skin to skin, little sexual activity, you can get scabies. Now, these are crabs. This is pubic lice. Now, millions of people get infected with pubic lice every year. They are tiny insects that look like tiny versions of the crabs. So they look like baby crabs. So the difference between crabs and scabies is scabies, they say, look like little tiny parasites you can't see. But these little suckers here look like baby crabs you see at the beach. They live on the skin and coarse hairs that are around your genitals, and they feed on your blood. Pubic lice spread really easily during sexual contact. Pubic lice symptoms include pretty intense itching, but even through pubic lice, it can be uncomfortable. They don't cause any serious health problems and usually easy to get rid of them with over-the-counter medicines. Getting pubic lice doesn't mean you're dirty. It has nothing to do with hygiene or cleanliness. Anybody can get pubic lice if they have close personal contact with someone who has them. About 3 million people in the U.S. get pubic lice every year. 3 million. How do you get pubic lice on crabs? Crabs are usually spread through sex because they like to live in pubic hair. Pubic lice can easily move from one person's hairs to the next person's hairs. So you can share your pubic lice with other women and men if you have it in your hairs and you didn't get rid of it, you didn't get it treated. All right? When their genitals hairs touch, crabs can jump off one person to the next if they're close to each other. Most people get crabs during sex, but sometimes they spread through other kinds of close personal contact, you guys. You can get pubic lice or crabs where there are other types of coarse hair like, eyelashes, eyebrows, chest hair, armpits, beards, and mustache. Crabs are really crabs. Oh my God, I gotta read this again. So you can get crabs wherever hair is coarse. Eyelashes, eyebrows, chest hair, armpits, beards, and mustaches. Yes, Katrina. Lord, it's just crabby. Yeah. Touch places on somebody else's body wherever they got crabs. Wow. Sometimes pubic lice are spread by using an infected person's clothes, towels, or sleeping in their bed. Yes, damn. Yeah. Crabs don't spread through quick, casual touching. They don't spread through like casual touching, like handshakes or hugs. And it's really rare to get crabs from toilet seats. Crabs don't live very long when they're away from human body. So they live good on the human body by sucking your blood. And they can't hang out onto smooth surfaces. Even though crabs are into hair, they usually don't like to hang out in their hair on top of your head. Pubic lice are different than head lice. Woo! And you usually don't get crabs in the hair or your head. Head lice usually don't show up in pubic areas either. Man, this damn lice. Well, I answered it. Can you imagine talking to somebody and you looking, Violet, I love you. Violet, check your email so you can track your package, sis. Now, can you imagine talking to somebody and while you're talking to them, you see crabs in their eyebrows? Crabs just sitting in their eyebrows. Thank you, Violet Royce. Can you imagine somebody talking to somebody, you sit next to them and they just yawn like this and they hold up their arms and crabs in their armpits? I'm going to just stay single. Okay, done. Or you can meet somebody and go on a doctor date, done. Go on a doctor date. Okay, I'm shaving my eyebrows. No, beauticians probably come across that. Ooh, bam, bam. Don't get me scared, girl. Don't get me scared. Now you're going to have me looking at people, period. Ooh, they say crabs can be in the mustache. So if he down there munching on your carpet and your carpet got crabs in it, crabs can get in his mustache and all in his beard. Can you talk about a crabby old this sucker crabby. Yeah, he got crabs in his beard and all in his mustache. Doctor date for sure, period. Yeah, it says it right here. Crabs, all in the beard and the mud. Krabby Patty. Yeah, let me shave everything off. Oops. Just go to the doctor, you guys. Have a doctor date. Be mindful where you put your mouth. Okay? Oral proximity can lead to a lot of dangerous things. You saw what herpes said. Herpes say you can put genital warts all around your mouth. If you got a cold sore and you put your mouth on somebody's genital, you can give them a cold sore. You can give a vagina a cold sore. You can give a penis a cold sore. Just go to the doctor, take regular visits, have a doctor date with your partner. And guys, get treated. Get the treatment that's needed to prevent and protect. Oh, they putting crabs in the comments. Don't start. Don't do that. No crabs in the comments, please. But do they cause you to itch? Absolutely, they do. Girl, let's read. Ooh, what are the symptoms of pubic lice? Let's go, Cupcake. All right, what are the symptoms? Now, Cupcake, remember, you can always hit tap join and come up and just have a conversation. Okay, veg for life. Before I bring you up, veg for life. Are you trying to come and ask a question because you are in the join box, veg for life? If you're not trying to ask a question, go in the join box and remove yourself. But if not, I'm bringing you up right now. Okay, veg for life. Do you have a question? She's all right. So remember, Cupcake, you're more than welcome to tap the join box, sis, and ask your question. Okay. All right. So let's talk about symptoms. All right. The most common symptom of pubic lice is itching near your genitals. You may also see crabs or eggs in your pubic hair. I'm not messing with anyone and here in this conversation. I can go a little longer. Yes, you can. Please keep crabs out of your mustache and your beard, Katrina, and your eyebrows and your eyelashes by refraining or sustaining from sexual activity. And that includes oral and regular sex. That's my PSA. Now, let's get into it. Pubic lice symptoms. Usually, the symptoms of pubic lice start about 5 days after you get them. So you can have crabs, a whole seafood platter, and don't even know you have a seafood platter because you haven't even started itching yet, and it's been 5 days. Some people never have symptoms, or they think the symptoms are caused by something else, like a rash. The most common symptom of pubic lice is intense scratching. Ooh, my friend Tasha. God bless the dead. Tanisha Myrick. Woo, God bless the dead. Is intense itching in your pubic area. Now you feel those bugs probably. The itching and irritation is caused by your body's reaction to the crab bites. Pubic lice symptoms include lots of itching, Cupcake, in your genital area. Lots of it. Okay? Super small bugs in your pubic hair. You can usually see pubic lice by looking closely, or you may need to use a magnifying glass. Pubic lice are tan or whitish gray, and they look like tiny crabs. They get darker when they are full of blood. They're blood suckers. Crab eggs called nits on the bottom parts of your pubic hairs. Nits are really small and can be hard to see. They are oval and yellow, white, or pearly. Nits usually come in clumps. Dark or blushes spots on the skin where pubic lice are living. These spots come from the crab's bites. Oh, feeling feverish, run down, or irritable. Crabs usually hang out in your pubic hair around your genitals, which is why it's easy to get them from sex. But crabs can sometimes end up in your other kinds of coarse hair, like your eyelashes, eyebrows, chest hair, armpits, beard, or mustache. It's really, really rare to get pubic lice in the hair on top of the head. Period. All right, so let's see if someone has a question. Cupcake has a question, everyone. Cupcake wants to join the conversation on STDs and STIs. Hi, Cupcake. Hi. All right. Well, but let's be real. You get lice and scabies from sexually transmission, and all you have to do is bathe them off your skin because they live with you. But a bed bug, we know, will bite you and disappear and live in your house forever, and you can't get them out. Because if that's the case, mosquitoes are blood suckers, and they're not related to that family. These are sexually transmitted diseases or sexually transmitted infections. So pubic hair lice, which are crabs, and scabies is in the STD family. A bed bug is a parasite. It's an infamous parasite, just like a mosquito. Yeah. So I feel because as even as grown adults, I don't feel as though we know everything. And if I'm going to be having conversations with Empress, which is my show that I'll be having every Wednesday and Thursday at 9 p.m. Eastern or 6 p.m. PST, I think we should bring awareness. We should have topics like this that are very educational and make people aware. Because some of the stuff we talked about tonight, we talked about chlamydia, we talked about gonorrhea, we talked about HIV and AIDS, we talked about herpes, genital warts, we talked about human papilloma virus, which is HPV. We covered a lot. Scabies, pubic hair lice. We covered a lot. And I think this is very informative and extremely important. What do you think, Cupcake? Mm-hmm. Stuff like this is needed, yeah. Because there was even a fact that I found out about herpes. There was a fact. But when we read about the HIV and AIDS, it really got deep. It dove deep into making sure people understood the T cell count. And not only that, HIV is when you treat it and use your medication as recommended, it the medication will actually help you. And not only that, it will actually, you'll at some point, if you do it as directed, you can test negative. And they did say once it's no longer detected, your T cell count is up, and you're not at risk, high risk of catching AIDS. AIDS is basically the final and worst step of HIV. So you can actually have both the diseases at once. I think this is very informative. I think this was a great topic to bring about. A nice troll came in my room today to apologize to me in regards to an event that took place with me and this young lady named Yetta some time ago. And apparently Yetta did an interview today with Godzeus in regards to her sexual activity, and she basically said she have sex and sex and sex and sex and sex with all these guys unprotected. So I felt as though in correlation with that, this would be a great topic and a great segment to bring about to make women aware and for protection. Well, that is where this panel is originating from tonight. I know a lot of people like mess and stuff like that, but it's such a shame that such a very informative panel is happening. And those people that wanted to find out whether or not she was sex addict and the diseases that she had, we're not over here talking about awareness and prevention. Okay, so. Mhm. So yeah, so I think we covered a lot of these sexually transmitted diseases. Is there anything that you wanted to hear about that you weren't here when we covered Cupcake? Because we can go through a few again. We have gonorrhea on the list, hepatitis B, herpes, HIV, AIDS, HPV, pubic lice, scabies, and syphilis. We didn't cover trichomonias, and we didn't cover contagiosum, molluscum contagiosum. Thank you. You're so welcome. You're so welcome. I'm glad I was able to be informative for you guys. Just trying to bring just a different spin on a lot of stuff. Now we will be having a court case coming up very soon. It's going to be a great court case. It's about an individual that got into a contest with this gentleman named Mike D, and there was $1,000 prize that was offered if someone won, and this gentleman won, and they don't want to pay him his $1,000. You're welcome to the real. I appreciate you for sending me money. I want to give you some gifts. Thank you for sending me money for my birthday, Darrell. Any questions? It's your opportunity now to come up and ask these questions of your famous voice. So the research, we just had a great panel of the research on STDs and STIs, and you just came in. We just had a great panel of research on STDs and STIs. It was so good. Okay. Now, anything you would like to add? Yep, we did cover. Yep. And what I wanted to say this to research, I heard a young man, a young gentleman, several of these kids on here. I take PrEP I take PrEP after they do their tricks, meaning they're having sex with all these strange men in the hotel rooms, and for so they won't test positive or to keep their HIV regulated, they pop a PrEP pill every single day. All right, so Mhm. All right, so let's talk about PrEP and PEP. Thank you very much. So PrEP again stands for pre-exposure prophylaxis. It's a daily pill that can help prevent HIV if you don't have HIV. So if you don't have HIV, this can help prevent it. All right. So taking PrEP every day can lower your chances of getting HIV from sex by more than 90%. PrEP is also known as a brand name Truvada. Okay. Now, who can use PrEP? PrEP isn't right for everybody. PrEP is for people who don't have HIV and are at a high risk of getting HIV. You may want to talk with your doctor or nurse about PrEP if you don't regularly use condoms. All right. Have a sexual partner who has HIV. All right. Also have a sexual partner who is at high risk of getting HIV. And and like if you like having anal or vaginal sex with other people without condoms, or they're an injection drug user. All right, now having anal or vaginal sex with many partners, especially if you don't use condoms, recently had STD like chlamydia, gonorrhea, or syphilis. All right, do sex work that includes vaginal or anal sex. All right, so let's keep it moving. How effective is PrEP? If you use it correctly, PrEP can lower your chances of getting HIV. All right, and using condoms with PrEP. It's really important to take PrEP every day. PrEP doesn't work as well if you skip the pill. It doesn't work as well if you skip the pill. If you don't take it every day, there might not be enough medicine in your body to block the HIV. PrEP doesn't prevent other sexually transmitted infections like gonorrhea or chlamydia. So use condoms along with PrEP to help you avoid the STDs and give you extra protection against HIV. What are the side effects of PrEP? PrEP is very safe. No serious problems have been reported in people who are taking PrEP. PrEP may cause side effects like nausea, loss of appetite, and headaches. These side effects aren't dangerous and they usually get better with time. Once your body gets used to PrEP, most people on PrEP have no side effects at all. If you do have side effects that bother you and don't go away, talk with your doctor or nurse. They can help you figure out ways to deal with side effects and make sure everything is okay. Oops. Just use a condom. Okay. Or some people abstain from sex. That was good. Hmm. So I think this is a very, very informative broadcast tonight. I'm glad that the topic was brought up for us to actually do it. Somebody has to do it. And hopefully, as these conversations with Empress get more packed, we'll do more and more informative conversations. All right. Just remember, you guys, as for my people that come up, Don, you can ask your question, but I want hosts to hold these spots. Hey, Don. Don, you have a question, baby? Yes, ma'am. That's why we're pushing the doctor dates. Ain't nothing wrong with holding each other's hand and let's go get a reevaluation. It ain't gonna hurt. Thank you, Tom. Mhm. We're never too early, old to learn. But it just goes back to the values and the different upbringings of our parents. Like some of our parents are uncomfortable with discussing these topics with their young men and young ladies in the house. They don't see that as important. They really feel as though your children don't need to be educated on sex education and sexually transmitted diseases and the know-how and the what to do if something transpires. If your daughter's walking around with discharge coming out of her panties because she's had sex with a young man and she don't want you to know, then this little young girl is going to be walking around smelling and with a disease all up inside her area, and she can't get it treated because mom hasn't opened that door of communication for her. So now she has to go out and sneak around, and hopefully some other friend or somebody else mom will take her. Hope if not, she just got to walk around with that smell and that discharge coming out of her vagina in her underwear until somebody say something. And God forbid if it just sits there for 6 or 7 months, go untreated, then the discharge is going to stop, but that infection is going to be still there, living and forming into something else over the years. And you wonder why some of these young women can't. Awesome. Mhm. All right. So thank you very much. You're welcome, my love. Thank you. So I'm glad you was able to get something out of it because we're never too old to learn. So I'm glad you was able to get something out of it. Okay. So L Beauty, you don't have any questions? Come up, L Beauty. And not only that, I would like to talk to some parents with young kids. I would like to talk to some parents with young daughters in the house that I want to know, do you feel the need that it's important to talk to your young lady about sex and sexually transmitted diseases? And if you think it's important, what age do you feel as though is appropriate? Mm-hmm. Aunt Beauty, Pip Lady, Cupcakes. So my question was, Pip Lady, was I would like to hear from some of these parents, these mothers or fathers that have young men and young women in the house. I want to know, do you feel as though it's appropriate to discuss sexually transmitted diseases and sex with your son or daughter? And if so, what do you feel as though it is an appropriate age? When should you? All right,
And also, if they
Dot,
could
we got
touch on what is the, I know it's been an issue for I have a friend that has a teenage daughter, and they did it as a prank, but it did strike some concern. What is the correct, or how, what age do y'all feel is appropriate to start buying your daughter's getting her birth control or getting your son condoms?
Okay, well, let's hold on. Let's before we go there, let's stay on the sexually transmitted disease. So, L Beauty, you have young kids, right? Young daughters, sons, whatnot. Do you feel it's important for them to know or bring awareness to them in regards to sexually transmitted diseases and sex? And if so, what do you feel is an appropriate age?
So I believe an appropriate age is 14. I have a 14-year-old and I talked to her about it. And then I have a 19-year-old and I have a 21-year-old, and they were about the same age as her when I talked to them about it.
Okay, so what if you have a 10-year-old that goes to school every day, and while they're out at P, maybe they're in the gym with other girls, they're 10, and 10-year-old is what, fifth grade, right?
Hear about that?
Yeah.
Hmm. Yeah.
Now, what if your daughter goes to school in the fifth grade and comes back and say, Mom, this young boy asked me, could he touch my breast? How would you address that?
I will just talk to her about t- people touching her, letting her know nobody is to touch her at all. Nobody.
Okay, we're going to add another parent.
And when my kids were smaller, when you said that, I remember talking to my children. I had the two girls and a boy. It as early as 5, teaching them the good touch, the bad touch. And then as they grew and mature, I would talk to them. You're going to meet somebody that's going to want to have sex with you. And they, of course, they want to know what sex is. And because my son, he was more inquisitive than my daughters. My daughters were very sneaky. And I
And
also,
at what age were they sneaky?
12, 13. Very
So at
sneaky.
12, they were sneaky. Okay.
Mhm, mhm.
Now, define sneaky.
Talking to boys, cheerleading squad, and doing. Oh, I'm gonna go around my dad's way, and dad is not watching them like I would watch them. So they would
Hmm.
say they going to the football field, and they're the cheerleaders. So of course my son will come home and tell me what they're doing. So
So
yeah,
would you feel as though age 12 would have been appropriate for you to talk to your kids about sexually transmitted
11,
disease?
yeah, probably even at 11, 11
And then
too.
again, and then like I was saying, to each its own as well.
Mhm.
Because Elle may have young daughters that are kind of slow in their process and growth. You had daughters that were moving a bit too fast in their process and growth. So you felt as though at 10, 11 was an appropriate time to jack your kids up and say, listen, this is
Mhm.
what's at risk here. Okay. So let's hear from Sexy Red.
Well, I think because I have a daughter, I think at that if they comes on to the woman thing, menstrual cycle, it's best to go ahead and talk to them about it if they like at
Mhm.
8, 9, or 8, it depends on when a cycle comes on. So it's best to go ahead and talk to them about that because they're gonna feel some type of way, and you have to explain a little bit more things to them as growing up as a woman. Because I had to step into that role and talk to my daughter. I said I'm a friend and a mother, and so I was teaching her a little
Hmm.
bit because she was asking me questions and I didn't know what to say, so I just go ahead and pull her to the side and tell her what the real deal is, and take her to the doctor and let the doctor explain a little bit more, so it can have my feedback, a doctor woman feedback, to get into the information of diseases, everything. So that's what I
And
did
then
because
not only that, mom,
my child came
and
up as
once you equipped her with that education, when she go out with her friends and they go talking that urban myth stuff and this mean that, you be like, girl, my mom told me blah blah blah, and my doctor told me. Like, they can educate many. Like, you know what I'm saying? Did Sexy Red leave?
Oh,
I
she
think
dropped.
Sexy Red, where you at, baby? Hold on, let me open up another box. Russ, you here with us?
Hey,
Hold on, let me open up another box with Sexy Red. Go ahead, Pip.
I just wanted to go back to the age and when it's appropriate. because I believe that children develop at different rates, their minds, their bodies, etc.
Mm-hmm.
So I think that as long as your child can comprehend what you're telling them, they are ready to have the conversation. If you see your child's body changing, you should probably start to have that conversation because that change can occur very early. That change can occur in
Okay,
elementary school.
that is true.
The
I
But
reason why,
what
agree.
if the people?
because, I'm sorry.
Go ahead.
Oh, I was just saying that to say because you don't want it to be too late. Because by the time I was 13, no one had that conversation with me. And here I am now, I'm in the 7th grade, I'm pregnant.
Mm.
And I had no idea that when you miss your period, there's a possibility you're pregnant. No one ever had that conversation with me.
And this is the funny thing. This is what I have to bring up. And it wasn't you that was seeking sex. It was someone
It
else
was men,
poking at you, right?
the inappropriate men. Absolutely. These were grown men.
So if mom wouldn't have just looked at, so your body could have been undeveloped.
Oh,
Mom wasn't going on the fact that your body is developed or not. What we could also look at the fact as it may not be you while we're trying to educate, but it also should be bringing awareness to this is what you should look out for as
no.
well.
Yeah.
What?
So
Yeah. So
definitely
go ahead, Pip.
when that body is changing, because when the body's changing, the mind may not be developed, but they may be being approached. So it's
Mm-hmm.
definitely time to have that conversation because here's the thing is when you educate your children, we can't really stop everything from happening in the world. But we can trust that we've instilled values and educated our children so that they know what to do in these situations. So I wish I would have had that skill. I may have had a different deck of cards dealt to me. Not that I regret any of it because it made me the woman I am today that I'm very proud of. Um, but it is very important to watch for different signs of development when you get ready to have these conversations.
Absolutely. Absolutely.
And that's it. I'm gonna drop down.
Okay. I know you don't. This is the
My
conversation. This
parents
is the
are here.
forum.
I know my
Yeah,
parents
we're
are
here.
I was just gonna say I agree because my 9-year-old is like a baby. She's really spoiled to me, so I just don't think that she's ready. She's 9.
But
Well,
what I'm
that's
saying is, Ab, if what if someone else makes her ready? To
here.
you, she's
Mm-hmm.
innocent and cute. But what if there's a young man or a young woman that
right.
makes her
Right.
so it's not that you should be. I mean, it's important to peer her and look at her and like she's so still innocent and she sleeps with me. But that peer pressure is a mother sucker. Them urban myths they get from those other young kids that stuff that's going on in somebody else's house, they will bring this to your child.
Oh yeah, I understand that. It happened to me
Hmm.
before.
So what if a child that age is being inappropriately sexual assaulted, and the only thing that stuck with them was what you told them about protecting themselves, and they said to their predator, "Okay, I'll do it, but can you use protection?" It might have changed the scenario of that situation. Just that one thing that stuck with her. So where we want to see our children differently, a predator may see them another way. So as long as we know they can understand, and maybe sometimes there are books out there to show you how to. So they're called social stories. There are all kind of different social stories that you can buy off of Amazon to help you deliver this information in an age appropriate manner.
Hmm. I agree.
And the crazy thing, I was looking on Megan's Law, and it lists like all the sexual predators in a certain area. And I typed in my zip code. I was amazed at how many females were on there.
Mm, mm, mm.
Wow.
Female sexual predators,
Hmm.
and no one thinks about that.
Hmm.
Okay, so I'm gonna
It's a
change this
lot.
live to sexual predators. How many were there?
I'm not sure, but it was overwhelming. It was a lot. And I was just like, this gotta be wrong. So I
Mm-mm.
exited out, exited back in. Because, of course, yeah, it'll be men. But it was like every 10 men, there were 2 and 3 women in just my zip code.
Wow.
So I do be telling people, look up Megan's Law and type in your zip code.
But it's such a shame that we always watch. Okay, watchdogUSA.com. I used to see my community. Really, you would see your community. Wow. So that's deep. So there are female sexual predators. Basically, for every 3 men, there's one. Is that what's our ratio? The biggest.
Hmm. And those are the ones
That
that
is
are
so sick.
court. Those are the ones that's court that registered.
And these are the one that's what you're saying. Yeah. So we don't really know how many are out there because they're not registered.
Hmm. Hmm. And you can't live a certain amount of distance close to a church, a school, anywhere children will be at.
I don't understand what ticks in these people's mind to where they feel as though they want to actually aggravate a young innocent child's body. I don't understand where they find pleasure in finding a little person squirm and scream and and beg and plead for you to stop. I just don't understand why they find pleasure in that. I have no idea.
And I
Yeah, all
remember
this grown see out here. I understand, right, Chris Nicole? It's the weirdest.
it is. I was in when I was in college, I took a course. It was a weekend course and you got 15 credits. It was sexual addiction. And I'm like, oh, it was a Friday, Saturday, and Sunday class for 8 hours each day. I was like, oh, this is going to be an easy A. I never in my life thought that, I never even thought sexual addiction was a thing. I never. And Friday, we sat down, we went through the textbook. Saturday, a guy actually came into class and he was a sexual addict. And he told us how he would, get ready to go to the club, put on, his and continue to do that until Monday morning. Mhm.
Jesus.
And they have sexual addiction classes just like NA classes. Every state
So
has.
he was one of the students there.
He came to talk to us because I didn't believe it. And he said it was the thrill of seeking out someone, going home with them, and having sex. It was a high, it was a rush.
Sheesh. Wow.
So these different addictions are real. And I
They do
actually had
exist.
to go to one of the sexual addiction classes, and it was deep. People were prostituting and
Mhm.
reading magazines, jerking off, and basically it's same principle as NA. Anytime something affects your job, your home, your health, it's an addiction.
A lot of these kids don't have a chance. A lot of our young people don't have a chance. And the sad thing is that addiction, they probably weren't even born with that trigger. Somebody altered them. Somebody sh- shook that young person and
Mhm.
made them unbalanced.
Mhm.
And therefore now they move around this world and this earth. They move creepy. They think different. They're looking. They're preying on people because somebody preyed on them. And they're on the internet search instead of looking for colors and coloring books and something fun to do at 8 and 9. They're looking up sexual websites now because somebody has
Mhm.
changed the trajectory of that little girl's spirit, her mindset, or that little boy's spirit in their mind. They're different now. They've been tampered with, so they're not the same. That same little girl that wanted to color butterflies and do her hair in pigtails is now looking for another fix, and that fix could be sex.
Yeah. And the sad part, if they go untreated, who is the next victim? It's their little cousin.
There you go. And the cycle
Yeah.
continues. And then now, since I'm already off my rocker, let me mix a little drugs with it because I'm out here now. I'm wide
Mhm.
open. I've run away. I want a taste of something else to go
Mhm.
in addition to what I'm doing. And there we have it. Young innocent girl turned drug user, turned sexual abuser, turned prostitute. Now she has a prison sentence.
Mhm. So yeah, and it is my granddaughter is 5, and her cousin, she has a the little girl is 8 or 9. She got kicked out of school because she's a sexual predator.
Mm. How old is she?
And
9?
yeah. Mhm.
What was she
And
doing at school?
playing with the other kids. Playing with the other kids, and her mom have some type of mental health disorder, and she allows her to watch porn with her and do certain sexual acts with her. So she tries it with the kids.
Mm-mm-mm-mm-mm.
So yeah, it's really deep. It's deep. It gets deep.
Yeah, we're judging these kids and we're not knowing why is she like this? Why is she like this? Nobody has went back to the root.
Mm-mm.
Nobody has went back to the day this person's whole life changed. No one asks why. Nobody don't care why. They just don't care. This daughter of yours is walking through the house. She's looking lonely and sad and she's moping. She used to be vibrant and happy. And mom don't even say, what's wrong with you? Why are you acting like that? No one even asks the why. The predator is in the house. The predator is in the house. And the predator is basically told this young girl, if you tell anybody, I will kill you. The predator is in the house, living in the house. And this helpless child has to bow down to a grown
Mhm.
adult hurting their innocent body every day, and mom and dad is right in the house and can't protect them and not noticing the change, the little girl's body odor, her underwear is coming up
Well,
missing. You're not asking questions. You're not watching. You're not observing your little person. And so this continues to happen over and over and over again because it never came to your mind to say, hey, what's going on with you? Why are you acting different? Why are you acting strange? Did somebody do something to you? Did something happen at school? You're not even asking those little questions.
hmm
How many of us
and
walk
now
past our kids and ask them, how was your day? How
you
was
have
your
to make
day?
these kids expand on those questions. They just can't, like my granddaughter, when she come home, she just can't say fine. What made it fine? And she'll tell me her teacher taught her a song, and she'll perform the song, and oh, I have homework, and I know how to do it, grandmom, and she'll sit down and do her homework, and we'll keep talking. You have to make these kids have a conversation with you.
All right, Mushy. So what is it that you share? What you got to share? How do you do this?
I'll just piggyback on what Cupcake was saying about talking to the kids when they at school. I talk to my daughter every day she go to school. I ask her how's her day, what you do at school, did you enjoy school, what happened in this class. I always communicate with her on that, and I always talk to her about sexual things. I started at a young age with her because
Mm.
she was able to understand it, and not to be putting her business out there, but she started her menstrual, so like I'm really on top of her with it now.
Mhm.
But that's all I wanted to say. Piggyback on that. I be on my daughter, like
So
waiting
my
on right.
question is, if you say, for instance, you were having a good conversation with your daughter and you asked her a certain question, with you looking in her face, would you be able to identify whether or not she was telling the truth or if she's lying to you?
Yes, because I started
And
that.
that comes.
Huh?
Go ahead.
No, I'm saying I believe so because I started early with her, as far as telling her about good touches, bad touches. So I know she'll be real with me if it ever happens.
And you have practice with her. Once you get to know your child, because a lot of us really don't know our kid. I know her, but if you can't identify and feel your daughter's energy by conversation, if you're not sitting in front of your child and looking in her eyes and just having that conversation, when her facial expressions change or her mood changes, you might miss a vital clue because you're
Mm-hmm.
Mhm.
not practicing communicating with your daughter. This is a practice that we have to do with our children.
Yes.
Yeah,
Yes.
study her movement, study this, study that.
Mm-hmm.
So, and a lot of us parents we're not steadfast. We're not getting into it. We're not getting to the meat and potatoes on what's going on with my child that's done flipped out on me. She's changing. Can't be just boys. What's really happening?
Mhm.
And you know how them country moms are, you smelling yourself. You're doing it. Girl, ask that child what's wrong with her.
And then you always, you try to teach your kid what your parent didn't teach you. Because
Mhm.
mom didn't really talk to me about stuff like that. But I was able to have my child at the age of 32. So, I knew better, even though I had a little talk.
So if you say you know better, that means you a virgin into 32.
No, I wouldn't say that, but I'm
Okay.
saying I was,
Oh,
more mature to have my baby at a later age. I kind of sometimes wish I started a little younger, but I was partying then. So I had her later in life.
so did you practice safe sex all the way up until you were 32?
Hmm. Yes.
Okay. So your baby
Yep.
was basically planned.
Yes, she was. more from her daddy than me, because I wasn't sure if I was ready to have a child because I didn't have one for so long. So I'm like, is that what I really want? And he's like, well, you're gonna have your first baby at 31. I was like, whatever. 32, I mean. It's like, whatever, whatever. And then
So was it planned or just was you just guessing stuff like Muhammad Ali? Or like was
no,
it planned? Like meaning, did you never
it was
have unprotected sex prior to?
yes. But I was
Okay.
with him the longest, so he was more like my regular boyfriend than anybody else. Because I was really
But
picky.
it is safe to say that you did have unprotected sex before him, so you could have accidentally got pregnant before you met him as well, right?
Mm, I wouldn't say that. Uh, I can't explain it without going into too much detail about my history.
No, the question was, had you ever had unprotected sex before you met him? That's all.
No, not really.
Okay.
Mm-mm.
And that's okay.
And
So you
to
did play it kind of sort of safe.
maybe we did plan it. He suggested, and then after a while we talked about it more, and then I was on board. So we both agreed we were gonna have a baby.
It sounds like good. All right, that's it. And that's on that. That's good. Well, I'm glad you have those talks with your daughter. They're so important, so
I have
vital.
I have to. It's too much that go on in this world where I can't. I have to talk to her, and she listens. You want to say something?
No, she need to go to sleep.
I wish she would. She got insomnia. She don't like to sleep. Go take a bath. But okay,
Oh, you gonna ask her if she want to say something? We ain't ready for that yet. Talk to the little people. Maybe I can do a panel when you bring your little person behind you.
you want me to get down?
Huh?
You want me to get down?
No, I didn't say get down.
Oh,
I'll be ending in 9 minutes, but y'all fine. Just gotta remember next panel, y'all gotta all be cammed up.
Okay.
Hmm. Yeah. So yeah, so that's the conversation. So Rich Savage, did you see me in your Bigo inbox today? Truth or down left. I'm talking about open
No.
heart, right? You didn't check your inbox.
I never check my messages.
Hello,
Check. Look at
everyone. Hi,
Fruitful's
Fruitful.
profile picture.
Let me calm down.
girl.
Hi. Okay.
Congratulations, Empress.
You just checking the cupcake?
Mm-hmm. I went,
So you know what that is?
you was live in the live house. Yes.
Okay. Okay. And what happened?
I just glanced. Oh, you was having conversations about any and everything.
In the live house?
Yeah, conversations with Empress Paris. Oh,
Not
live
in the
now.
live house.
Yeah, live now.
No, what
Oh,
that is Bigo has me now in there. This goes out to everybody's inbox all over Bigo.
mm-hmm. Oh, wow.
Yeah, so that's the woo.
They finally sent it to me. They sent it to me late.
Yeah, but that's the wrong Bigo ID and it's the wrong time.
Bigo better recognize. Period, savvy.
Period.
Let me get the big ones.
Mhm. Okay, so quick little commercial break. I got my essential bomb, period. I'm so excited. And I just can't hide it.
Is the
And,
website open again?
Carter is
huh?
I'm tired.
And
So
my
now
BB lounge.
Period, savvy.
No, this is an FSF replicates.
You be on the run, Empress.
I just did so many packages over the last 3 days. I don't want their website open right now. I need a break. So what I was gonna do is just go live and let my local customers come in my house.
I'll probably put it over there in the morning.
What do you go back to work?
I'm off until probably February the 1st.
Okay. Oh, that's good. You need a break.
Thank you, Katrina. I told myself I wasn't gonna open it, but I can't wait.
I'm jelly fruitful. I don't get mine till next week.
Oh, you'll be okay. I got mine, Nanny Boo Boo.
Okay, that's payback for me saying I was
Mhm.
did was screwed. Okay,
Mhm.
get it.
Cause you was just rubbing it
Thank
all
you.
in my face earlier. Look at God. Not even 24 hours later.
It's the petty for me,
Have
but
y'all
that's okay.
talked to Miss Diverse?
No, I didn't actually. Let me check on her. Okay.
The outbreak up here is so bad. I know of at least 50 people in my immediate circle that had to get tested.
Yeah. What is the name of the new strand of COVID?
It starts with the O. I'm not sure the name.
Omicron is the newest.
Omicron research.
Omicron, uh-huh.
Okay, I'm gonna look at it.
When I went and got tested, now they do the saliva testing. And you can't eat, drink, or smoke 30 minutes before you take the test. And it takes 2 to 7 days
You
for it to
can't do
come.
what? Pooh?
Eat, drink, or
You can't
smoke.
do what?
Eat, eat, drink, or smoke for 30 minutes before you take the test.
Okay.
Because it's the saliva.
Oh,
Hmm.
every day someone at my job will test positive. It's crazy here. Are you serious? Are you vaccinated, receiving? And so are you wearing your mask, baby? Oh my God.
Yeah. And my client that has it, he's vaccinated. Two of my staff tested positive. They're vaccinated. But I can honestly say the symptoms aren't as bad.
Omicron. They are trying to finish us off. This don't make sense. A whole nother variant. Like
Mm.
where are these? Then you have the Mu variant. So now you got Omicron, Mu variant. Oh my God.
I feel like they making them up as they go. They just,
They're creating them.
yes.
Mm-hmm.
Your son positive juju. So are you making sure you give them the hot steam and the orange pills and the pineapple pills and the lemon pills, hot tea, rub big salve on their neck, all in their chest and their back, hot towels, and then you want to beat them in their back to make sure you're breaking up their phlegm, like beat them and keep their phlegm broken up.
I,
Make sure he's
I,
spitting up on a regular basis.
I never thought about their hot Vicks.
Mm-hmm. There you go, research.
What's that
Let us
research?
look at research. His stuff is his garlics and onions and lemons and limes. He good
I
at
think
juju, baby. You keep
that's
that baby.
specific.
Make sure he stays spitting up.
I
Make
think that's
sure now. Hold on, y'all. Me.
garlic. I love fresh
I hate
garlic.
this chair. Kill me. I need a new chair.
I
Cause this
love
chair gonna
garlic.
kill me.
Yeah, I cook it. Oh my gosh, it's so good.
Yes, God is good in everything.
Mm-hmm.
Hey,
So, Risha, you still didn't get the vaccine, right?
research. You all vaccinated, brother?
Man,
Are you vaccinated, boo?
no.
You think you gonna get it?
No. I don't do any vaccinations. I'm part of the population of people that vaccinations do more harm than good, so I don't take them.
I feel the same way.
Um, I found out several years ago. I took the flu vaccine and I got like deathly ill. So my doctor at the time, well, my doctor now, said it's probably best if I don't do any vaccines. And it's part of the requirement for working in the hospital, but I was exempt because vaccines don't do me good. But it's in writing.
You too, Bam Bam.
what my friend bought me today. Some buffalo chicken dip. Anybody ever heard of that?
Mm-hmm.
Yes.
I
Yeah.
didn't. Not to today.
Is it spicy? Did you taste it?
It's nice. I have it here.
It's
It's
good.
I never had it. Today, this is my first time.
I never had it before, but I know I like buffalo chicken wings.
It's cute. It's cute, boo.
Okay, period. Now I'm gonna have to pick some up. I found them
Mm,
chips you was eating at one time. Them was good too. The Cheetos mixed with the popcorn.
baby. Ooh.
Them was good. I was in
Mm,
the store. I was
mm.
like, these them chips. They wasn't bad. They was actually pretty good.
You have like a not no overbearing. They're nice.
Yeah. Kind of remind you like of like a party mix. Like only thing it was missing was
Mm-hmm.
like pretzels. Mm.
Y'all, that was a good conversation.
Wait, let me stop.
Definitely.